Welcome to the Burn Bootcamp podcast. I'm your host, Morgan Kline, co-founder and CEO, along with my husband and company visionary, Devan Kline.
And together, with our amazing team, we are going to help you push past your limits, not just physically in our gyms, but right here, mentally, emotionally, and spiritually on the Burn Bootcamp podcast.
Together, we will take on challenges and break through barriers to transform into the best possible version of ourselves. We are more than a gym. We are a community. Your community. Let's go, Burn Nation.
Hey everybody, and welcome to the Burn Bootcamp podcast. My name is Devan Kline, and I am the visionary and co-founder of Burn Bootcamp, and I am here with a very, very special guest, Amy Kiser Schemper. Welcome to the podcast. Amy is a certified personal trainer and fitness instructor with 15 years of experience in this amazing industry we call the fitness industry. She is a certified pregnancy and postpartum corrective exercise specialist. I know how difficult it is to understand the body, especially in those periods of a woman's life. And we're very excited to dive in with her on those topics. And she is very passionate about helping women navigate their fitness during pregnancy, postpartum. And as you all know, once you have a baby, you're postpartum forever. Mm-hmm. And so, through her fitness and through her passion for fitness, she's created multiple workout programs, Body Fit by Amy, Body Fit Moms. She's a wife to Kurt Schemper and a mom to her two kids, Kai and Maya. Amy is a master's of science, exercise science. She got her degree from Concordia University in Chicago and 2 undergraduate degrees from Virginia Tech. And so certified up, all the letters after her name to back up what she's talking about. And Amy, we are so excited to have you here today on the Burn Bootcamp podcast. Welcome, my friend.
Thank you so much for having me. I'm really excited to be here.
Yeah. So if anybody has been listening, if this is your first episode of the Burn Bootcamp podcast, you know that we're not going to traditionally just kind of go right into like, hey, what's your background story? And so Amy's going to weave her background story in as we go through these questions, because we really want to kind of dive right in and go right at it.
Yeah.
And whenever I see pre and postnatal certifications, I'm like, I'm like salivating, tell me more.
Yeah.
Cause this is something obviously that I'll never have to experience personally. Right. But at secondhand through having 3 children,
Sure.
I've been right by my wife, Morgan, and we have a pre and postnatal certified specialist in-house called Ashley Hearn.
Yeah.
And so, I'm excited for you to dive into those topics. So let's just start there. Like when we talk about pre and postnatal fitness, where do we start? How do we begin to learn about it so that we don't, injure ourselves, or that, we're safe as we go throughout our journey?
Yeah, I think, when I had my first pregnancy in 2016, I had been a trainer for a lot of years. I had done the gym circuit. I had taught classes. I had trained people for years. And so I felt like I had a little bit of a background in that. I had trained pregnant clients, but it is so different when you go through it yourself. And I think my husband would say the same. He felt like he went through it secondhand 2 times with me. But I think at that time, it was also kind of coinciding with a sort of a movement in the fitness industry. And I credit social media a lot for this, of we're finally talking about pelvic floors and deep core and recovery versus just fitness, right? So I think the timing of my first pregnancy, we were starting to learn more and talk more about what does this really mean? It goes way beyond just how do you modify a workout, right? It's not just, these are the things you should do. These are the things you shouldn't do. This is how you get back to it. There's so much more going on in your body. And so I think, in pregnancy, we hear about nesting, where people say, I was nesting in my pregnancy, so I rearranged the baby's room and I cleaned out the closet. And for me, I was just like diving into the information on pre and postnatal. That's when I was applying to grad school, and it's crazy now to think about it. But I started graduate school when my son was 2 months old, which now I'm like, you would only do that with your first, because you don't know what's coming. But and then got I have 2 different pre and postnatal certifications. And the corrective exercise one is a lot more about recovery and dealing with things like abdominal separation and pelvic floor dysfunction. And I think I just realized, like, even if you think you have the knowledge, as I thought I did as a trainer previously with a lot of years of experience, when you go through it yourself, it's totally different. I had 2 very different pregnancies, 2 very different deliveries. And I think when I got pregnant the first time we had our YouTube channel for a couple of years and it was slowly growing. And I wanted to really authentically put that out there, both with the education and the knowledge, but also be my authentic self of like, this is how I'm feeling. This is what I'm going through. This is how it's affecting my workouts. So, you know, it was two sides. It was diving into the information, wanting to look at the research, wanting to, you know, see what other people were doing and what we were learning. Because as you know, fitness is always changing and evolving. And then also, you know, be true to my own experience and see how that was, you know, I'd been working out my whole life, grew up playing sports. Like it was just a very different experience, pregnancy and recovery. So that's kind of where it started. And then I think that's really, if we look at, you know, the different times since I've had my YouTube channel, my online community, that's when we started to grow, online, because that's a home fitness audience, right? You know, moms are often just trying to squeeze in a workout whenever they can, or they're looking for community online because they're home with the baby or home with the toddlers. So I think that's when I really realized too, like there's power in this community. And it, you know, for a lot of people, like at your camps, it's in person. For other people, it's online, but there's power in the community of fitness for that pre and postnatal period, as well as just physically what's going on.
Yeah, for sure. Yeah. Community is the glue, regardless of, you know, really whatever part of the fitness industry that you like, whether it be like yoga or burn or online workouts, at home workouts.
Sure.
There's community is always the glue to that. I love that. That's your philosophy. Let's talk about, like, let's define some things real quick, because I think it's really important not to just breeze over some of the more anatomical driven definitions. So pelvic floor.
Yeah.
Like, let's just start with like, what is that even?
So your pelvic floor muscles are the set of muscles at the base of your pelvis. So we often describe them like a hammock. So they're your muscles that are really supporting all of your internal organs. So when you think of it that way, like that's a big job, right? So in addition to all of the other functions that they have, when we go through pregnancy, those muscles are supporting a lot, right? We're growing, everything is changing in your body. And they also are the muscles that this is a common misconception, is that those pelvic floor muscles are what pushes the baby out when you have a vaginal birth. No, their job is to relax, actually. So it is a thing of, you have to train your body to, like every muscle, contract and relax. But when we talk about those muscles, we often describe them as the foundation of a house. And that when you think about building a house, like if you don't have that foundation, that strong foundation, everything else above that is affected. So we have to train the pelvic floor like other muscles and know the importance of it. Whereas, 10, 15 years ago, nobody was talking about that. We were talking about prenatal and postnatal fitness of, these are some things you should avoid. These are some things you should do. But we were not talking about it in that way. And then just also looking at it like the true medical event that pregnancy and postpartum is. If we looked at what happens in your body during pregnancy, what happens during labor and delivery, and also just general mom life, parenting life, like that is intensely physical, right?
Like and the surgery, like it's like a medical procedure. And we don't often think about it in the same category.
Yeah, if you were to send somebody in for a knee surgery, you would send them home to rest and rehab and go to physical therapy. And as moms, we're just handed a tiny human to take care of.
I've never really thought about it that way. Yeah. But now that you say that, it's just so glaringly obvious that that is such, it's so normalized because a lot of
that's what we've
children,
done for years,
right? But it is crazy now that you put it that way.
Yeah.
Like I've had a knee surgery and it's like, and then I saw the postpartum recovery protocols for Morgan, and it's like they took way better care of my knee than they did with her. They're like, hey, just make sure you if you're feeling hungry, eat some Burger King. Yeah. And maybe just don't work out for a few weeks.
Yeah,
and
you get like 1 6-week appointment to be like, all right, you're good for everything. And you're like, well, what do I do?
Yeah, my body feels,
And I think that's why it's important that, I always tell people, I'm like, look, there's a lot of healthcare providers are amazing, and your doctor's job is to be the doctor to you and get the baby here safely. It's not their job to design your fitness, and they may or may not know, the latest in pre and postnatal fitness, but that's why they're specialists like me. That's why you all have Ashley. It's, that's where you want to look to get your fitness information. Of course, along with the guidance of your doctor, knowing what's specific to you in your pregnancy and your postpartum. But that's what we're here for, is to say, like, here's what has been happening in your body. Here's what's going on now. How can we adjust our fitness to that?
And so I'm going to ask you a few questions still around pelvic floor, because
Sure.
I think that is, as you mentioned, it's the hammock
Yes.
that
Yeah.
holds all of
Foundation.
the foundation of the house, which I love that visual. Now, there's so many people that have really probably never even heard the term pelvic floor.
Yeah.
Like if they are getting into fitness
Yeah.
and they've never been into fitness before, maybe you've never even heard that term. Okay, so let's talk about when the pelvic floor is compromised. You've mentioned there's this cascading effect.
Yeah.
What is the pathology of that, and what problems could we maybe hone into if we have this problem? Okay, well, my bladder is leaking and I'm
Right.
peeing when I'm jump roping. That's
Yeah.
the most common one
Yeah.
from my perspective. And I was like 25-year-old guy. And I have a bunch of moms in the gym as I'm training them.
You're
And they're
like,
like,
"I don't know."
I'm like, you guys are sweating real hard. They're like, no, Devin, that's pee.
Yeah.
I was like, oh, okay. Is this a problem? Like, do you feel, are you okay? Is this a medical emergency? And they're
Yeah.
like, it's just, no, I just got to go to
Yeah.
the bathroom. And so, and then I was like, okay, this is a problem. Let's bring Burn Boot Camp into that world. And that was
Yeah.
the moment that I really wanted to dive in and learn more. So what is the pathology out, I mentioned one problem, but what are some other problems that could arise that could be a symptom that we have some pelvic floor issues or some other issues?
Yeah. I think for a lot of women, it is the urinary incontinence. And for some people, that's stress incontinence, like when you're jumping or when you're running, something like that. And other people experience leaking at other times. And I think, what has happened is we often say, like, common does not mean normal. And I think we have normalized things like that of, oh, this is just what happens when you have a baby. And, women have been told that for years of like, oh, well, now that you've birthed babies, that's just going to happen. It does not have to be your new normal. There are ways to train for that, but it also goes beyond just Kegels or Kegels, people say it differently, but it's your whole core as a unit has to work together. And what happens during pregnancy is you're growing, you're expanding, there's a lot of load and it's down on that pelvic floor. You already have that pressure down on your pelvic floor, out on your abdominal wall. So when we do things that maybe increase that, like certain things during exercise that maybe were fine before you had that additional load, that additional pressure, we're going to increase that intra-abdominal pressure. And that's what we want to do our best to manage. And one of the best ways to do that is to know how to breathe, to know how to engage your pelvic floor along with your deep core during exercise. And then that also really aids in your recovery. So a lot of women experience the incontinence. There's also something called diastasis recti or diastasis recti, which is ab separation, which, when you first get certified as a trainer, it's kind of like, this could happen, but you don't really learn much about it. And I actually had it in my second pregnancy, and I was doing all the right things, trying to avoid certain things, but sometimes it just happens. So knowing that a lot of the things that could happen, certainly there are things you can do to manage your risk, reduce your risk, and be safe about it, but it doesn't necessarily always mean you're going to prevent it. Mm-hmm. And that was the case with me. So it's how do we deal with that? I was like, oh, I'm doing all the right things. I'm a trainer. How did this happen? It's just how my body responded. And it did not mean that I couldn't go back to fitness. It meant I had to be super specific about how I did it. And I still have ab separation, but we call it a functional diastasis recti. I can create core tension. I can manage the pressure. I can do planks. I can do all the things, but I had to think about that as something, different about how I was training. If I just jumped right back into planks and crunches and things like that, it could have done more harm than good. So it's for a lot of women, it's just realizing, okay, these are some things that could happen. They may or may not, but either way, even if you have the most uncomplicated pregnancy and postpartum period, you still want to focus on recovery and taking it slow and getting back into it in a certain process.
So what I hear you describing, or if I'm correct, please correct me if I'm wrong, two separate issues where you have pelvic floor that becomes weak, I would say, through pregnancy. Because the body's mobile and it's moving. Is that the reason?
Yeah.
And then also the same thing, but with your abdominis, your abs, your outer abs.
Yeah. Your rectus abdominis.
Yep. I was trying not to do the scientific stuff.
I know,
I'll leave that up
right?
to you.
But
That's what
but
it is.
You know it too. Yeah.
And so the rectus is actually separating.
Yes.
Okay.
And for some
then,
people, it's more severe. For some people, most of us have a little bit of separation, but some people have severe diastasis. And that is when, we always recommend seeing a pelvic floor physical therapist. Like, I can help you in certain ways with fitness, but there are pelvic floor PDs who are out there.
So if I'm going into fitness or if I'm going into pregnancy and I'm somebody that's like, okay, I have a sister or my mom told me about like this might happen and I'm concerned with that.
Yeah.
The preventative measures that you can take are really what?
Learning how to breathe, learning how to manage pressure, learning how to recognize signs. There's always can I lift heavy when I'm pregnant? Can I still run? Things that people really enjoy doing. You can, but if you're not managing that pressure well, that is when we're going to see, that added pressure out on the core, down on the pelvic floor.
So is that why we are taught to stay away from, let's say, pull-ups in the third trimester? Is because of the internal pressure that's required? Like you almost have to push out?
Yeah. Yeah. And I mean, it's like when you think about super heavy, I mean, there's techniques, right? There's the Valsalva maneuver. There's things like really heavy lifters that you're bearing down.
On purpose.
So on purpose to lift heavier. I mean, I have thoughts on that technique just in general, but I think for a pregnant person, that is absolutely not what you want to be doing. So then translating that to just your regular fitness, doing your squats with a heavy load of like, okay, you can still lift heavy. You just want to make sure that you can manage the pressure doing it, that you have the support, and you may not. You may be super strong and you may have been lifting that weight for years, but everything is different in your body during pregnancy. So knowing that that's not a sign of weakness, it's not a sign of like, you want to push through it the way we maybe normally would. Just knowing that like in pregnancy, your whole goal is just to have a healthy pregnancy, healthy baby, healthy mom. And it's not when we PR.
Right. So, that's, we hear that, everybody?
Yeah.
Okay. Pregnancy is not a time to PR.
Yes.
Okay.
And I get it. I'm competitive and I want to do all the things, but it's different.
So I'm going to ask you in a moment to kind of walk me through a 9-month pregnancy cycle, or maybe it's longer than that.
All right. Yeah.
All right. Whatever cycle. But before I do that, you made a good point that I think it's a controversial thing that I see out there. And you see this a lot in the CrossFit world. And I'm somebody that loves all forms of fitness.
Yeah,
I think that there is so much room in this industry for removal of ego and people like us to communicate and collaborate and collectively try to band together to help people. And so this is in no way, shape, or form, how would you say, a diss on CrossFit. This is just, I've noticed this through mostly the CrossFit avenue, and I want your opinion on it because to me, it's a very fine line. And here's the fine line. You see an amazingly strong, powerful woman. She's lifting Olympic lifts, and she continues to do that all the way up until delivery. And there is a full baby, you're a couple weeks away, and we're loading up a barbell and we are doing snatches, we're doing cleans, we're doing deadlifts, we're doing pull-ups, we're doing all these movements that we would normally do. I look at that and I'm like, man, the fine line is, wow, what an amazing, powerful, strong, incredibly inspiring woman versus, is that what we should be doing? Is that more detrimental than it is inspiring? Yeah. So what are your thoughts on that? And, what are your thoughts on that?
Yeah. I mean, I'm the same as you when it comes to fitness. I think like there is room for everything because at the end of the day, if you connect with something in the fitness world and that's your thing, that's what you should be doing. Because we're interested in consistency, right? It's not about getting everybody to come to Burn or everybody to come to Body Fit by Amy. It's about like, let's just move. And so people love CrossFit. And there are some amazing, amazing athletes. To me, it's just, like everything in life, it's risk versus benefit. And I think a lot of women truly know their bodies and maybe they're working with a pelvic floor specialist and maybe they're working with a coach. But at the end of the day, those heavy lifts, those heavy, like power moves, it's still putting that pressure. So especially someone who has gone through the recovery of a C-section, but recovery of having ab separation, It's just going to make things more challenging in the long run. And some people are fine. Again, people's bodies respond differently. The fascia responds differently. The muscles, for some people, they recover really quickly, but it's not worth the risk to me. And I think that's why my recommendation usually in that third trimester is like, you can still lift heavy. Let's pull back a little on the power. Let's pull back a little on the overhead lifts, the things that you're really going to feel that pressure. Because what's the point? We want to stay strong, but we're not out to prove anything. And if it means that your recovery is going to be longer or tougher, or that you're going to have these lingering issues, I would rather minimize my risk than try to, be competing in the CrossFit games. And again, women are amazing. I think the disconnect happens online, because I'm in that online world. This, it can be brutal, is that when women are shamed for saying that's going to hurt your baby, chances are it's probably not, because women's bodies are amazing and, all the protection is there. But what it could do is it could injure you. You could have a pelvic floor injury. You could have ab separation. You could be increasing your risk for complications. So I think that's when women get really defensive of like, I'm not hurting my baby. I want to be healthy. But for me, at the end of the day, we want to minimize the risk of things, and we can still lift heavy. We can still go hard. We can still train, and we should, but with some modifications.
Okay. So, that's really good. I appreciate your take on that. And I think it's a super logical, informed, rational take. Yeah. And I think, that's a good answer. Yeah. Like there's no absolute, yes, you should be doing that, or no, you absolutely should not be doing that. There's context that needs to be added. So, okay. But baby's okay.
Baby's probably okay. Again, it's that thing of like, there are certain things we know. We don't want to be exercising in high heats. Right. Like we don't want to be doing hot yoga in pregnancy. Your body's already at a higher core temperature. We don't want to be doing a lot of balance exercises, because again, you could be great at doing a box jump or one-legged pistol squat or something like that, but riding a bike, but do you want to take that risk that you could fall or something like that? So there are things that we know, but, at the end of the day, it's just like wanting to take the precautions just to make things easier for you also in the recovery period. Yeah,
so. I love that. Yeah. Okay. So let's go through a normal pregnancy. Sure. I'll call it a pregnancy cycle. Yes. I don't know what the proper term is for it, but first of all, how long do you really think that is? And when you program 4 people, I would assume that it's obviously longer than 9 months. Yeah. But break that down for us. And then let's walk through maybe each trimester. Let's walk through postpartum and really just break it down as deep as you can on what to do, what not to do. Sure. If we can be specific as possible with like dates, by week, get specific for me.
Okay. So with the specificity also comes the disclaimer of every pregnancy is different, and you have to listen to your body and talk to your doctor and all of that. But what I'll say is that there is sort of this period of, a lot of people will come to me with the question of like, I'm trying to get pregnant, or I hope to be pregnant in the next year. What do I need to be doing? And I think the general advice is, be your strongest self. That is obviously your body is, you don't need to be, you don't need to be super gentle with your body when you're trying to conceive. Your body wants to be strong. You want to be increasing the blood flow and the oxygen and strengthening your muscles and building the endurance. So everything that you can do at that point, whether that's your regular routine or, jumping into knowing you want to be strong during pregnancy, that trying to conceive, TTC, we often call it, is a great time to really be focusing on just strength and health. Then when you're pregnant, we generally say in the first trimester, the dates can be different depending on who you're asking, 13 or 14 weeks, you can keep doing most of the things that you're doing, especially if it's your first pregnancy and you're not really seeing a lot of the physical changes. You're not seeing the belly pop or anything yet. But that often is the time that you're exhausted, you're sick, you might be nauseous. I was abnormal in the fact that I was super sick the entire pregnancy. That's not normal. But in that first trimester, a lot of people feel that. So you do want to adjust for that and know that it's not, again, you're not failing if you need to take it down a notch in your workouts, or you need to skip a workout because you need to sleep, or, you're going to be exhausted. Your body is going to be starting to feel the changes. So that first trimester is a great time to kind of just get familiar with certain modifications, some things that you might want to change for you. We also experience relaxin, which is the hormone that, our bodies need to, let the hips and the joints open up for pregnancy and for delivery. So sometimes people really feel that in things like single-legged movements, a lunge or a step up, things like that. So just being aware of the changes in your body and adjusting for that.
And that relaxin comes on right away.
It does. And people feel varying degrees. So it's another one of those things that it's going to be specific to you. Personally, I felt fine doing a lot of unilateral movements but in my second pregnancy specifically, in my third trimester, I really felt it, and I felt a little unsteady, and I felt like, if I go too low in this, I'm going to overstretch. So just being aware of how your body is reacting.
Does that have any correlation to prerequisite strength coming into a pregnancy or relaxin?
Not really. Everybody is a little bit different in just how their body responds. So that is one of those things that it really is like a, listen to your body kind of thing. Just be aware if you don't feel as steady as you maybe once did in something like a lunge or a single leg deadlift, things like that. That would be the time to start adjusting.
Okay.
Then we get into the second trimester, which is usually around that 14, 15 week mark. And that is when, for me, just to put a timeline on it, that is when you really want to start modifying some core work specifically. And that's also when you start modifying, you can do this in the first trimester too, but just your intensity level. Mm-hmm. Again, you can still go hard, you can still push, you can still get that adrenaline rush that so many of us love, but you want to be able to carry on a conversation. So we call it the talk test,
mm-hmm.
Which is often something that we say for like, how do you know that you're at the level that you're increasing your intensity? Yes, that's when you know. So in pregnancy, we want to do the opposite. We want to stay below that, right? Okay. So as long as you and I can carry on a conversation where we're working out, then I'm managing that intensity.
And why? And just like a couple notes on why is that? Like why do you want to stay below the talk test?
Yeah, your body is working overtime. You're growing a baby, and you're increasing blood flow, oxygen, all the things that are happening just in your body normally, and then you're working overtime. So interestingly enough, a lot of women in track and field, they will often PR when they're pregnant, maybe before they know they're pregnant, because your cardiac output increases. It's kind of amazing. It's one of those things that it's like, wow, women's bodies are incredible. But because of that, you have to manage knowing, okay, my body is working harder than it normally is just in this workout. It's also working really hard to care for this baby, to grow this baby. I want to pull it back just a little. Again, that is also going to be specific to what is your capacity for that? So years ago, the advice was given to women of keep your heart rate below 130 or 140. But 140 for me in pregnancy versus somebody else could be wildly different. That could be, pretty moderate for me and really high for somebody else.
That's too generic.
It's too generic. Yeah. So now we just say talk test. If you can carry on a conversation, you're probably in a good zone. You can push yourself. You can, get all those things that you love out of a tough workout, but just managing that.
Is there any world where that doesn't apply? Like, let's just say, somebody like yourself, one of our burn trainers.
Yeah.
Super fit coming in to the pregnancy. Does that ever not apply? Like if somebody does feel really good, should they consciously take it back? Or if they are feeling good, is it a feel thing and can they push it? It's just not recommended.
I think it would be that, right? There's the things I would say as a trainer and the things that, if I had a high level athlete or a fellow instructor, something like that, your body. But again, it's like risk versus benefit.
Right.
I certainly, especially in my first pregnancy, was teaching boxing and boot camps and things like that I really loved. And just knowing okay, I still feel good. I can do this. But I also am used to pushing myself through that feeling of knowing when to kind of pull back on that. And I always say, I think pregnancy is such a metaphor for parenting because you have to learn to make those changes on the fly. And everything that could be different, and you have to learn to be flexible. So just knowing you should pull back a little, but again, you're not going to hurt the baby if you get really out of breath in, a camp and your heart rate is super high. There's no cause for alarm. Just hydrate, slow it down. I think I have a pregnant client right now and she's like, I'm just so scared of everything because you see everything online. And I'm like, I think we're in an amazing time where you can get so much information online, but it's like Google is kind of the best and worst thing to happen to
Yeah.
pregnant women, because you can be scared of everything,
Right.
because we're trying to give a lot of information.
Yeah,
So,
navigating the information jungle out there is not, that's why you're here,
Yeah,
buddy.
right?
That's why you're here. Just cut right through it. Tell us
Totally. So so you're going to be fine. Don't be scared if you feel like you get, we're out of breath, but certainly it's a good idea to pull back just enough to feel good and feel like you can have a conversation.
Okay, so we're at 14 or 15 weeks.
Yeah.
We're
into that second
staying
trimester.
below the talk test
Yeah.
threshold for the most part, where you can hold a conversation.
Yep.
If you want to kick it up every now and then because you're feeling good, listen to your body is what I
Yeah.
hear you saying.
Exactly.
But generally speaking, 14, 15 weeks talk test.
Yeah.
Like, let's just take the intensity back. Let's manage for the long term.
Yes. Yeah. And then also in that second trimester, because that's usually when we see that belly pop and we're starting to get more of that, what we were talking about, intra-abdominal pressure. That's when I tend to recommend that people start modifying things like planks, things that, sort of avoiding the spinal flexion or extension, overly rotating, and keep things more of those stabilizing movements. Again, that's a great time to really practice your, I call it TA breathing, transverse abdominis, but diaphragmatic breathing through your deep core, through your pelvic floor. That's a great time to really get connected with that core work that you're going to be doing for many weeks.
So let's stop real quick on the breathing stuff. So elaborate on the breath work. Maybe give us an example.
Yeah. So TA breathing, or often now it's called diaphragmatic breathing, would just be breathing through your pelvic floor and your deep core. So your TAs are the deepest layer of core muscles. They act like a corset around your internal organs. And then you have your outer layers, those superficial layers we were talking about, the rectus abdominis, your obliques, your back, all of that. But your TA, if you can breathe through those muscles and release the pelvic floor, and then as you exhale, contract, that's going to give you that strong, stable foundation that we want. And that's a great way to train your core for delivery, for labor, and then for the postpartum. So a lot of us breathe, right? We breathe up and down, or we often call it backwards breathing. So if you can learn to breathe, inhale out, exhale in, you're going to feel that deep core connection, like what that does to your inner core and your pelvic floor. So that's something that sometimes people come in and they're like, oh, this postnatal and prenatal core work is so boring. I'm like, yeah, it is. But it's so important.
Mm-hmm.
And once you kind of really get the concepts, then you're like, yes. And it transfers to, I have everybody do deep core breathing, whether you've been through pregnancy or not, because we all need to connect with that deep core. So learning to breathe in that second trimester. And then I start modifying things like planks. Sometimes people feel super comfortable and strong in a plank in that second or third trimester. But again, just because you can doesn't mean you should. So if you think of the weight pushing down on that abdominal wall, we want to avoid that as much as possible. So elevating on a box, taking it to the wall, dropping to your knees into that quadruped position, all fours, things like that. All of that could be really helpful as you start to carry more weight in the center.
So this is really good that I don't know a ton about these topics, because then I get to ask really interesting questions.
Yeah.
So I would make an assumption that, okay, as soon as you find out you're pregnant, the hormonal changes begin to take effect.
Yeah.
And relaxin is one that we've mentioned already, is the pelvic floor and the rectus abdominis, the pelvic floor weakening and the rectus abdominis stretching, I guess is the best term. Is this actually something to do with actually growing the belly in size, or is this something to do with hormones?
It's both.
Okay.
It's both. But I would say the biggest culprit is the weight of your belly expanding, and your uterus is growing, and you grow a whole placenta. It's like all of those things that are happening internally that are going to increase that pressure. And then every movement that you do, getting up and down from a chair, getting out of bed, all of that, you're feeling the extra weight. And again, nothing to be afraid of. It's natural. It's what our bodies are designed to do. But knowing that, I can manage the pressure, I can be aware of what's happening in there, that's going to just empower you to have that strong foundation throughout the rest of your pregnancy, through delivery, and into the postpartum period.
So it's really about internal pressure.
Yes. Yeah.
And then every time, you mentioned the Valsalva maneuver, and that's when the body builders go, and they just hold their breath and they squeeze everything internally so they can get that extra rev. I remember. As a former college meathead, I definitely did that.
That was
a lot.
A thing. But when you think about what's happening, that's not good for men either.
For sure. But it is about the internal pressure, and it is about the increase in the size of the belly as you go through pregnancy, as you grow, that increases the internal pressure, then which makes every external movement that you do that much more, how would you say, have that much more of an effect, because now you're compounding the internal pressure. And so that's why when Morgan's trying to get out of bed in month 8, she's like, just to try to get out because the pressure's so high at that point.
And that's why, that's a great example of like, we as pre and postnatal trainers will say like, hey, when you get there, let's start rolling to our side to get out of bed, so we're not like just coming up like that, where she probably has great core strength no matter what. You could do that, but should you, and again, like you got to get out of bed because the toddler is crying and like there's all the things, like parenting life is tough. So don't beat yourself up if you're not doing those things. But if you can be thinking about those things of how can I be managing the pressure and having the core control throughout everything that I'm doing. And we learn that in our workouts.
So as the abs start to separate, okay, the internal pressure, the growing of the belly starts to push the abs out.
Yeah.
Is it true that you don't want to train rectus abdominis at all during once that starts to happen? Because most people think you're going to train your abs in the wrong place. You're going to train them to be strong in the wrong anatomical posture. Is this true?
Yeah. And I think, the bigger thing is just that what we think of when we think of, obviously a stabilizing movement like a plank, something isometric is going to train that as well. But we think of our spinal flexion or our extension or rotation, things like that. That stuff, again, all of that is going to increase that pressure. And also, yes, everything is different during pregnancy. A lot of us get what we call rib flare, where we're sticking out a little bit, anterior, posterior pelvic tilt, your pelvis is tilted. And again, a lot of that is unavoidable because of how your body's responding to pregnancy. But if we are really focused on like, how do I train in this posture? How am I going to adapt once this baby is out, right? So knowing that, that's why things like the breathing, like stabilizing movements, like elevating things, you're going to be able to do that throughout and adjust and get back, And again, it's like, just because you can doesn't mean you should. And also like, there's going to be plenty of time to, when people get concerned about core or, getting back into doing the things that they love doing in their workouts. We'll have time. We'll get there.
This is fascinating to me, and I thank you for sharing. So let's pick back up at
third trimester, I think.
Third trimester. Yeah. Okay.
So that is when things start getting real. I think, again, everybody is different in how they respond, but you generally, it's that thing where I look at pictures of me at like 7 months pregnant and I look like I'm 9 months pregnant, like everything is growing, you're, retaining fluid, a lot of things are happening in the body. And I think, your modifications are generally the same as the second trimester of like modifying that core. Although maybe you were doing a plank or a push-up on the box, or on a bench, and maybe you want to take it to the wall because you're just feeling more of that downward pressure. You may want to start taking things low impact. And that again, like I taught kickboxing the day before I delivered my son. And with my daughter, I felt so much different. I wasn't doing anything high impact probably throughout my entire third trimester, just because that's how it felt to me. So it's just really being aware of how your body is feeling. And I do recommend you want to stay strong, but again, like really, really heavy lifts in that third trimester or like high power moves, things that are going to really increase that pressure. Let's take those back a bit.
Okay.
So yeah.
Okay.
Yeah.
Okay. What are we? Okay. So you're basically going to maintenance mode.
Yeah.
If you're getting sweaty in the third trimester, that's a success. You're not trying to push it.
Nope.
You're just trying to maintain,
right?
How much of that is really just the mental side of things, like just to stay moving and to not, how much of it is mental versus physical in that third trimester when you're really not trying to make any physical gains?
Yeah. I think the thing is like there's the mental and the physical side. Like we're talking about, like there was an article a while back that talked about pregnancy is like running a marathon, like literally looking at the physicality of what's happening, except that you do it for 9 months and you don't get a break.
That's a long marathon.
That's a long marathon. But like you, again, if we looked at that outside of the context of pregnancy, we'd be like, you need to train for that. That is tough. So you do want to stay strong. What I think too, in the third trimester that can be really important is that you're prepping for delivery, right? And no matter what kind of delivery you have, your body needs to be ready for that. And when we look at labor, it is a HIIT workout. When we think about if you have a traditional, uncomplicated labor that you have contractions, then you have that little lull in between, then you push, during those contractions, that is your high intensity interval. And then that little lull in between is your recovery. So, that's where a lot of our endurance work, again, with, making sure that we're able to talk, we're managing that intensity, that can be really helpful as you train for pregnancy. It is like the true HIIT workout. Again, instead of 45 minutes, you're going to get maybe 20 hours. Not fair, right? But also the other thing in the third trimester is working on relaxing your pelvic floor. We talk so much about strengthening your pelvic floor, which is important, but also relaxing because you need those muscles to get out of the way. So if you're, if you have a vaginal delivery, that's their job. Their job is not to push. Their job is to get out of the way. So that's also a time that we really work on that relaxing. And a lot of that is, your child's pose and your happy baby and some like flexibility, mobility things that can prepare for that.
So as we are coming up to the big date, delivery date,
Yep.
How does it change as you narrow into, that delivery date? And what types of exercises might you have clients, members doing to prepare for this in and out of the hospital? When does that start? And just elaborate on around delivery date for me.
I think that the labor prep stuff, your deep squats, you think of things that are going to kind of open up sort of those hips, things like that. Really preparing for mobility of, like rolling on a ball, putting your hands on top, things like that. And again, like the mental side, back to your original question that I totally went on a tangent on, which is what I do. That is usually when you don't feel the best in that third trimester, you're getting right there. So keeping moving just for your mental health, which really at the core, I think of what I do is like why we train in prenatal, postnatal. There's like huge physical reasons why we should, but just feeling good for yourself, doing something for you, knowing that you're taking care of yourself, getting all the things that we love about workouts, like the adrenaline, the endorphins, the rise in those serotonin levels, all of that as your life is about to change is really, really important. So staying moving for that, and also allowing yourself to rest. I think with my second pregnancy, I really was like, okay, I got to keep moving because I'm going to have this baby. I'm going to have to take 6 weeks off, but I just was not feeling it. And I took walks and I rested and I, allowed myself to be, something I always say is be where you are today. And that is where you are in your journey, where you are really today. Like, how are you feeling today? So that was a good lesson for me, especially with my second pregnancy, because it was very different. So knowing that, you want to keep training, but also you may just want to take a nap.
Yeah.
And that's okay.
I definitely secondhand had seen that play out. And well, I'm going to jump to our second child and tell you the story. And I want to hear your response. Mm-hmm. But before we do that, let's finish out the fitness side of things. Yeah. Going into delivery. Okay. Now we're there, whether you do a home birth or your hospital birth, we're there. Yeah. Like it's day of, maybe water's already broken. Maybe, you go in a little early. I know we jumped the gun 1 or 2 times. Yeah. But okay. So you're in the hospital room, you're in your bathroom at home. What exercises are you doing to help prepare for this to be as smooth as possible? Yeah.
I mean, the one thing that we do know, it's interesting. I have a workout on YouTube called Labor Inducing Workout, and it's total clickbait, which I don't really like to do, but it's basically just labor prep. It's like a 10-minute workout, but it gets a lot of hits and people will say, this totally worked for me. And I don't know that there's things you can do to really induce, but I think preparing your body we know that movement helps. It gets everything. Walking is one of the best things you can do. There's a thing called curb walking where you're walking, 1 foot on the curb, kind of that unsteady, just to kind of get things moving. Again, your deep squats, your things, even if it's not a deep squat, sitting on the edge of a chair, letting those hips open, again, lying on your back, happy baby, things like that.
Deep squat mean like almost like a catcher's stance?
Yes,
like you just
yes, exactly.
Okay.
Yeah. And that can be not comfortable for a lot of people. So I say sit on the ball, take your knees out wide, sit on the edge of a bench, a chair, something like that. All of that can be really helpful, but also just, squatting to whatever is comfortable for you. Maybe that's a ball on the wall. Maybe that's a sumo squat, just, half rep, things like that. That could be really helpful. And honestly, again, working on that breathing, working on that pelvic floor, contract, release in that 3rd trimester, focusing on the release, because that's what we want. In the postpartum period, which is what we call the 4th trimester, right? You had those first 12 or so weeks after you have the baby, we're going to get back to strengthening that pelvic floor because that's when we're really going to need it. But that 3rd trimester, we really want to focus on the release. And that is the part that I think that gets missed in a lot of pre and postnatal fitness of just do your Kegels, just do your Kegels. Well, if you have a hypertonic pelvic floor too tight, that isn't as helpful during labor or in your recovery. So we want to make sure that you can, like every muscle, contract and release.
So in the 4th trimester, now post-delivery, we roughly 12 weeks.
Yeah.
Things begin to normalize.
Yeah.
What's, generally speaking, how long does that take? I know the uterus shrinks.
Yeah.
I know, obviously all the fluid and everything, you just start gradually starting to return to normal.
Yeah.
How long does that take? How long before the hormone relaxin that we mentioned is that even a thing when you're not pregnant?
Yes.
Okay.
Your body's still producing it, especially if you're breastfeeding.
When is it? Okay. So talk to me just about that. What is the reversing out process and when are we generally speaking back to normal? And is that aligned when the doctors clear us? Because in my experience, the doctors didn't ask any of those questions. No. They just had a generic time frame, which it's maybe not their job to give those recommendations. So that's your job.
Yes, that's my job.
Okay.
So, I would say in the first several weeks, prioritize recovery. I think that's, there's certainly things in my postnatal programs, we'll have you breathing and doing pelvic floor connection and core, deep core connection at any point when you're ready. That's not working out, but you can get started on some of those things. But generally speaking, those first 6 weeks, just rest, recover, hydrate, eat, try to sleep if you can. It's such a, it's such a challenging time when you have a newborn, especially if you have other kids at home. So really knowing that your body needs to recover. And again, knee surgery, you are told to have that recovery. You're told to rest. You're told to, take a break. We can't necessarily do that as moms because we're taking care of a human. So as much as you can, let your body rest during that time, and you can start doing the breathing, you can start doing the connecting, but there's no need, even if you get cleared, because sometimes people do get cleared earlier for exercise. I had a client who was cleared at 3 weeks. Doesn't mean that you should jump right back in. And then when you do get that medical clearance, and again, for doctors, they're checking to see that you are medically clear, right? They're checking for complications. They're checking if you had a C-section, how is your incision doing? If you had tearing, are you recovered? They're not there to say oh yeah, you could go back to running, or, oh, you could, they're seeing, has your body recovered in the way that, we expect and want it to in these first 6 weeks. So I think the mistake a lot of people make is they think, okay, I'm cleared. Okay, I'm a runner. I'm going to go back to running. Or, oh, I'm a CrossFitter. I'm going to go back to, and your body is usually not ready at that point. So knowing that in addition, that's why we call it the 4th trimester. You want to treat that similar to your 3rd trimester, where you are modifying the core. You are focusing on pelvic floor and deep core work. You are focusing on moderating your intensity so you're not overdoing it. Knowing that, everything that you're doing in life is physically demanding. I mean, rocking that baby all night when they're not sleeping, that's a lot. That's a lot of work, up and down throughout the night. The baby's just going to get bigger. You're going to get stronger. It's knowing that you're already doing something so physically demanding, even if you feel ready to get back into doing, especially when it comes to impact or heavy load, because your core isn't completely recovered. So it's hard to put a timeline because some people, their core recovery is a little quicker and they feel stable going back into running maybe at that 12 or 16 week mark. But generally speaking, I think when it comes to adding load, I think take at least those first 4 weeks after your 6-week clearance to keep things body weight or lighter weight, especially things that could be bearing down on your pelvic floor, out on your core. Then start adding in the weights. Doesn't mean that you have to start crazy light or that you have to feel like, oh, I'm a beginner again. Again, you're carrying that baby all day. So you're already lifting heavy, right? And then getting yourself ready to go back into the impact. And that could be, we do like single leg movements to get you ready for running, or we do, like a modified jump squat, something where you're just going to come up, but you're going to keep it grounded, things like that, just to know that when you do get back into that, not only have you built the strength, have you built the core control, but you've let your body have time to recover. I think that's a big part of it.
So Ashley Hearn, who is our pre and postnatal specialist here at Burn, and then several members had over the years, educated me that once you are postpartum,
you're always postpartum.
You already know what I was going to say, right?
Yes.
So in effect, there's this long 5th trimester that it's an inevitable, to experience that and the byproducts of a childbirth for pretty much the rest of your life.
Yeah.
I'm assuming. So let's finish this kind of segment here on going through the 5th trimester. Do you call it that? Is that a thing?
I think I'm going to start calling it that, and I'll give you credit. Give you credit that
this is my contribution.
The 4th trimester is those 12 weeks after birth, and then everything else is your 5th trimester. I like it.
Okay. All right. Well, if you want, just give me a little credit in your Blue Next book and like the back section. I'll come on your podcast and I'll be like, you know what?
I coined that term.
Let's talk about the 5th trimester. Okay. So talk to me about that. Now we're cleared.
Yeah.
We've done your program.
Yes.
Okay. And we're feeling better.
Yes.
We're getting into it. If you don't do the 4th trimester the right way, what happens if you do the 4th trimester the right way? This seems to be a very important time.
It is
to prerequisite to the 5th trimester to the future.
Yes. So what I would say is yes, once postpartum, always postpartum, because I've had clients come over the years and they say like, but I'm, my baby is a year and a half. I'm not postpartum. Like, yes, you are. Like you're postpartum when they're 20 years old. Like you've been through that, and your body is still, in a lot of ways, certainly you recover and you get stronger and you can get back to doing a lot of the things that you want to do, but you still have to be aware of a lot of different things. And that 4th trimester, the one thing I do want to say is that a lot of times people don't get to that work in the 4th trimester, right? They're, life gets in the way. They have a colicky baby. They have other toddlers. And sometimes women are coming and they're like, my kids are 4 or 5. They're finally in school. Now I want to focus on me. You still want to do some of that core recovery work, even if you've recovered from the pregnancy and the delivery, but maybe you don't have that connection. What happens is that we go through this pregnancy, we have a baby, somebody hands us a human to care for, and those muscles are deconditioned. They've been stretched, they've been through trauma. So our body is amazing. What does it do? Everything else comes in to compensate, right? So our glutes, our low back, even like our other parts of our core, our obliques, hips, things like that, hip flexors are going to come in to help you when you're doing the things in daily life, like carrying the babies, lifting the toddlers, things like that. So then they get used to doing that. So women come, and it's been years since they have had babies, and they still want to work on that deep core and pelvic floor connection because their bodies have been compensating for years. And often if you don't do the work, to do that, you go into your workouts and you do that. So you could see somebody who could hold a plank and be look super strong in their core, but it's all those superficial muscles. It's their glutes helping, it's their hip flexors, it's their low back, and maybe their deep core is not firing in the way that it should. So that's why I recommend that everybody, if you didn't have a proper core recovery, or, you didn't do that core work in the first several weeks, once you can exercise, you can do it at any time. And you at least want to be doing some of that as you when you get back into fitness, whether that's weeks later or years later. And then within that, I think it's just always being aware of that. Like I'm never going to, and again, I would say this for everybody, that deep core work and pelvic floor work is just going to aid in everything that you do. So even men have a pelvic floor too, like knowing how to engage with that. I had a male client who had a back injury, and a big part of his recovery was pelvic floor work. And he was like, I didn't even know that guys had that. So knowing how to engage, you're going to be stronger in your lifts. You're going to be stronger in your workouts. You're going to be stronger in your activities of daily living. So, I think it's in the postpartum world, certainly in the immediate postpartum, we need that, but really for the rest of our lives. And, women come all the time and they say like, oh, I'm not strong, or I can't lift heavy. And then I'm like, how much do your kids weigh? How much do your kids weigh? Like,
they're like, oh, they're proud of it.
Yeah, I know. I love that about kids.
They're like 52 pounds, 46.6 pounds, and 29.8 pounds.
I love it.
They weigh themselves every day. They love it.
If only the rest of us could be that way.
They want to be big like dad. That's why they do it. Like, Dad, how much are you?
Yeah.
You're 210. Wow.
I can do it.
I'm going to be 210. I'm going to go eat some chicken.
Right? Yeah, there we go. Yeah. So, when you think about that, like, I'm like, you think you can't lift that 10 pounds when you're lifting 40, 50 pounds all day long? We want to balance that. We want to get more functional with our movements so you can feel better when you're doing that. So you don't have back pain because you're carrying the 50-pound toddler on this side.
Especially the car seats. Like when a baby's in a car seat, like I'm struggling to.
I mean, that's what I said that after my first. I was like, how does anybody who doesn't work out do this? Like, and we just do. We just adapt. So knowing like we want to balance that. We want to be training for life in that way, because those kids are only going to get bigger, and they'll still want you to pick them up. So
when you're talking about the pelvic floor muscles, I believe there's a muscle down there somewhere. Is it called the perineum?
Yes.
That muscle.
Yeah.
When I meditate a lot.
Yeah.
And I like to, when you say breathing techniques, I'm like, ooh, tell me more.
Yeah.
But I am just like always trying different ways to meditate. My favorite one is Kundalini meditation. Have you heard of it?
Yeah.
Where you're pushing up like energy through your perineum, through your belly button, up through your heart, up through your throat, up through your head. And you're trying to like push energy out like to the top of your head. It's the pelvic floor and the perineum, the same thing. Are the two?
They're different, but they're connected. It's all part of that.
Okay.
Yeah. Because
I need to brush up on my anatomy here. It's been a while since I've been working the business for a long time. I haven't done a lot of anatomy lately.
Well, and what's interesting about the female pelvic floor is that it's pretty intricate. And so a lot of times, for years we told women, do Kegels, and the way you should Kegel is squeeze like you're trying to stop the flow of urine, right? Like you're peeing and you want to stop, right? And what happened when we use cues like that is we end up squeezing our glutes, right? Because that's what we know, and that's what we do in class and things like camp.
You did it! Yeah, let's go.
My class, your camp.
Yep.
But knowing that, like, that's what our brain kind of computes as like, oh, okay, I'm going to squeeze my glutes. But how do we translate that to pelvic floor? And what we have learned, in the pre-post industry is we have to use different cues, and we have to use anatomy like the perineum, like the anus, like the vagina, like the sits bones. So when we think of the pelvic floor for women, especially, it's your pubic bone, your tailbone, your sits bones. And if we think of it like, I often will use a tissue as a visual, like you're lifting like a fishing net. You're lifting like you're trying to lift a blueberry. You don't want to squish the blueberry. You want to lift it. So strong, but gentle, right? So we're not over gripping with the glutes. We're not creating that tension in other places. We're actually using the muscles to lift, or like sucking through a straw. So I love that you do that. You're probably way more in tune to your pelvic floor than most men.
Yeah. It was a weird sensation at first.
Right?
Yeah.
But you really connect with your core. I mean, on the meditative level, it's totally different too, but like just when you use those cues and you can really visualize, and you're like, oh my gosh, I never knew. Like I was just squeezing with my glutes. So
that's kind of like, especially on guys, because we don't necessarily have to worry about delivery.
Right.
We've got there's this like section of lost muscle.
Yeah.
That like, as a guy, you don't think about your inner thighs, your pelvic floor, your perineum.
Sure. Yeah.
And I started doing Kundalini meditation quite often, maybe once every couple weeks or so.
Yeah, good for you.
And, I can really notice a difference in my lunges.
Mm-hmm. Yeah.
I notice a difference in like my spring back.
Yeah.
How it feels I just feel tight.
Yeah.
I feel tighter. I feel like in more control. So even for guys, I believe that it's a useful muscle and set of muscles to exercise.
Yeah.
And so I wanted to share a story with you.
Sure, please.
Because I want to you've mentioned a couple times about C-sections.
Yes.
So we have our daughter Cameron, vaginal birth. It goes great. Everything's good. Morgan follows a lot of the advice that you're giving today. And we go in, we want to recreate that with our second, and we're there. Everything's going seemingly the same. All of a sudden we're in the hospital room and we hear beep, 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 beep.
Heartbeat. Yeah.
Nurses run in, doctors run in. They come in. They're not like
oxygen.
They're not.
All of it.
They're not like happy. They're not panicking. But I'm intuitive, and I'm like, you guys don't like that very much, do you?
Yeah.
And obviously, the sound beep beep is like that's an alarm. Like you're not.
We've all seen that on TV.
Exactly. Okay, so they go out, or they come in, and they say, if that happens again, all right, we're going to come back in and we're going to have to make decisions. That's all they said.
Yeah.
Okay. So they leave about 5 minutes later. Beep, 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 beep. This time they don't just come in. They come in. They have a mobile bed for Morgan. They put Morgan in the mobile bed. They don't say a single word to me. They don't even look at me, and they're just gone. And I'm like, at the time I was reading a book, just trying to keep my mind off it. I look up and everyone's gone. I'm freaking out. I'm like, what's going on? And I'm like, I feel hopeless, in a sense.
Yeah.
I'm like, what's going on? And the nurse goes, yeah, you can't go back there. And I said, nurse, listen to me. You've got to tell me what's going on at the very least. And then she goes, hold on, I'll be right back. And then so she comes back. I have this whole basically hazmat suit, and then I'm able to go back. And what happened was Maxwell, our first son, as Morgan's water broke, he had the umbilical cord wrapped around his neck and he was suffocating. And so emergency C-section. That was an experience of a lifetime.
Yeah.
I got to witness everything that happened back there. And we don't need to go into the details, but for those of you who have witnessed that before, it is mind-blowing. The medical procedure that goes into a C-section. And so I'm scared for my life, Morgan's life, Maxwell's life. Yeah. And everything ends up turning out really great, as great as it could. And they said if we would have left him in there for 5 more minutes, that you never know what could have happened, because the deoxidation could cause brain damage. It could cause who knows what. Oxygen obviously is the cure-all for in the gasoline that keeps our life running. Right. And so Morgan had a C-section. It was an emergency C-section, and it wasn't one that we planned for. Sure. And so just a long way to ask this question, as you're going through all the, we just walked through basically 4 trimesters plus a postpartum 5th. What's different when you have a C-section? What's different when you've had a baby that way rather than vaginally, and what considerations do you want to make? It is all the stuff that you said. Does all that hold true? And what extra precautions do we need to take? And then maybe, a lot of women prefer a C-section. Ours was an emergency. Some prefer, and they will have it scheduled. And just talk to me about C-sections and what to look out for if you're thinking about pre-scheduling one. Yeah. If you do have an emergency one. I know you like to bounce around and move laterally, so I'm just giving you this dish of things to talk about. And let's go deep. Let's go deep with C-sections.
Yeah. So, well, first of all, I really appreciate you saying vaginally versus natural, and I think that's a big
I'm doing
part
good.
of you're doing great.
Oh, good.
Because and I don't fault anybody who does say that, because that's been the language forever. Like, did you have a natural birth or did you have a C-section? But for women who've been through that, it's a little bit. There's some stigma around it, right? Oh, I didn't have a natural birth because I had a C-section. And I can tell you, and Morgan can tell you, it is not the easy way out. It is really challenging. The recovery is challenging. And it's, my doctor said it this way, and I truly believe this, that every C-section is an emergency, not to that degree. And I had a very similar experience of the beeping and the oxygen. And then I was sent to the hospital to be induced. And then when they started, his heartbeat was dropping, and it's terrifying. Right. And like, it's terrifying for us. It's terrifying for the partner. My husband was the same way. He was like, I don't know what to do.
I'm not used to feeling hopeless.
Yes, exactly. Yeah. And you're used to feeling kind of in control, or like, I can fix this. I can do this. So I appreciate you saying vaginally, because I think that's one thing that we can all start with, is just changing the language so we can reduce that stigma of like, and when women, usually nowadays, when women schedule a C-section, it's because there's a medical reason, and it may be something that seems minor to us, but it's big to them, So I think all C-sections, there's a medical reason, and thank God, because Maxwell's here, my son Kai is here, like we're all healthy and happy and safe. Within that, I would say, like, for me, one of the hard things was that my whole pregnancy, and it was probably the same for Morgan, everybody was like, oh, you're so fit, you're so strong, you're just going to push that baby right out. And then my first was this emergency C-section, and I was not expecting it. I knew it could happen. And logically in your mind, oh, this is the best thing. I'm so grateful. All that matters is that the baby's safe and I'm safe. But it still can be really hard. And for me, most things in my life, like I was an athlete growing up. I didn't come by things really naturally. I just worked hard. I just hustled, So most things physically in my life that I wanted to do, I could do. I want to play this sport. I want to run a marathon. I want to be a trainer. Like I could do that. So this felt like, well, this is the one thing that as a woman, naturally I should be able to do, and my body couldn't do it. So I think we sometimes brush over the emotional side of it for women, because we think like, of course, the only thing that matters is that everybody is safe and healthy. But that doesn't mean that it's not hard for us emotionally and then you add in breastfeeding and everything else that goes along with having a newborn, and you're, emotional to begin with. So there's that side of it. And then I think on the physical side, because you've seen it, I think it's 7 layers that you're going through. You're going through the skin, you're going through the fascia, you're going through the muscle, you're going through the uterus. Like there's so much that is happening that is being cut through. And doctors are amazing because they do it so quickly too, right? And you're like, I look at my scar now and I'm like, a baby came out of that. But so there's a lot that your core has gone through, or that area has gone through. So knowing that, yeah, you're going to have to be gentle with that. Again, I would say a lot of the core recovery is going to be very similar to what I would recommend for anybody, of the breathing, of taking your time. But with the C-section, it's just being more aware of, you're going to have adhesions, you're going to have scar tissue. What can be really helpful that most women don't do is massage or, scar release, mobilization of that scar. Your best bet is to have a pelvic floor physical therapist or somebody do it for you. But there also are videos online and pelvic floor PTs that put stuff out there of how to do that. It takes a little while because it's super tender for a long time, but mobilizing that scar is going to help you not just improve that area. A lot of people talk about, oh, I have the C-section shelf, or I have, lots of extra skin there. That's going to help with that, but it's also just going to help you move better.
Is that when the scar looks like it's very tight? It looks like tight, and it kind of like
almost like a flap.
Yeah,
over.
Yeah, because the scar tissue's so wound up right there, and they haven't kneaded it out the way they should.
Yeah, so mobilizing that area can be really helpful, and that's just something super simple you can do at home, just with some lotion, just kind of getting that feeling back, because it's tender for a long time. And then just, again, being gentle with your core, knowing we need to work from the inside out. We're not going to go back into our traditional core exercises right away, and even for a while. I mean, and there were certain things for me. Lunges were really hard for me for a long time, because every time I lunged deep, I could feel it. So knowing that you may have to make some additional modifications, and that's okay. I just needed to have more time for that scar to recover and for everything to get mobilized and get more blood flow to that area. But the core work, again, you just want to take it slow. You want to work from the inside out. You want to focus on the breathing. You want to focus on the connection. And then we'll have time later, once everything is healed internally, your scar is healed, all of those things, that's when we can really rebuild that strength.
The recovery in 4th trimester, as you begin recovery, I saw obviously both the vaginal birth and a C-section. It was like 300% more difficult with the C-section.
Yes.
After Cameron, Morgan kind of would get up and, she's definitely feeling it, but could kind of do the old lady shuffle around the house. And when after the C-section surgery, it was like, she had I mean, it was a
Yeah.
really major surgery.
Yeah.
And I just remember her mom coming down and just really me and our nanny at the time really having to pitch in extra.
Yeah.
Because Morgan is a very independent woman.
Yeah.
Like she wants to do all the
Yeah.
things. And she was physically
It's
incapable
really
after
tough.
the C-section. And it was
Mhm.
just like this natural hunched over.
Yeah.
And it's like right in the center of your body where like even standing up straight was difficult
Yes.
for her.
Yeah.
And so does that extend then the fourth trimester recovery period for a lot of women? Or how do
Yeah,
you
for
think
a
about
lot
that?
of women, I think it can, again, some people feel better quicker. Some people feel like they're, externally that the incision heals quicker. So a lot of it can be going by how you feel. But again, when you think of all the layers that get cut through and all that has to heal, I felt the same way. I joked that my neighbors, probably didn't know I would go out and walk the dog and just be like walking like an old lady. And you're used to using your core we use our core for everything we do. That's why we train it, right? In fitness. And you all of a sudden you can't get out of bed. You can't do any of the things. So, again, being gentle with yourself, certainly having a good support system. I was the same way. I was like, I'm fine. I can do this, but you really can't. Having that support system, allowing yourself that time to rest. And then when you do get into that core recovery, really taking it slow, working from the inside out.
So the team pulled together a couple myths.
Oh, okay.
All
Yeah.
right. And I wanted to run these by you.
Oh,
and
I love a good myth busting.
and we love to pull really reputable stuff.
Sure.
Like
I
isn't,
appreciate that.
Yeah,
Yeah.
this isn't like
Somebody's Instagram.
I had a baby.com/org/ca/
Right.
whatever.
Yeah.
This is from John Hopkins.
Okay, great.
Okay. And they wrote an article discussing some myths surrounding exercise, pregnancy, and with you being pre and post certified in performance training, especially, we wanted to get your professional opinion on them. And
Sure.
I feel like there are also some listeners out there that struggle with wanting to either continue their fitness routine, but again, going back to like the fear mostly of harming baby.
Sure.
And so I've got 3 myths here for you. We'll take them one at a time.
Okay,
You ready for
great.
it?
I'm ready.
Okay. Myth 1 is from this article is if you don't usually exercise, you shouldn't start during pregnancy.
Yeah, that's an old one that goes around a lot. And I think it's kind of similar to the keep your heart rate at 140 or below and the, only lift 40 pounds or things like that. But it's old advice that sometimes is often still given. ACOG, the American College of Obstetricians and Gynecologists, which is kind of like the governing body for everything. And we look to them because they're looking at the current research, recommends that everyone with an uncomplicated pregnancy, again, talk to your healthcare provider about what's right for you, should exercise. What we know now, the old days of like, oh, you should rest, put your feet up, that does more harm than good. Blood flow is so important. We're at higher risk for blood clots when in pregnancy and postpartum, mobility, delivery. And we know from the literature that like women who exercise during pregnancy, have a better recovery, but they generally have less medical interventions, less complications. They're lower risk for all things like preeclampsia, things like that. So it's now recommended for everybody. Now, does that mean that you can jump into like, training for a marathon or, certainly you want to think about what you're doing, but everybody should exercise. And I would add to that, everybody should strength train because sometimes it's recommended like, oh, you should walk or you should swim or you should do yoga. All those things are great. You should also strength train.
Amen, sister.
Yeah.
So myth 1 is actually busted by the governing body.
Busted. Yes.
So if you don't usually exercise, you should start exercising during as long as, with the caveat, there's no extracurricular complications that would prevent you uniquely otherwise from doing so.
Exactly.
Okay. All right, that's settled, everyone. So if
Now
you
you know.
are pregnant, planning on becoming pregnant, all right, you got to go see Amy. You got to go see one of the 400 Burn Boot Camp gyms out there. Myth number 2. Athletes can continue vigorous exercise throughout pregnancy without a cause for concern.
Yeah. It's that second part, right? Like you can continue doing a lot of the things that you're doing because your body is has adapted to that, but you still have to look at risk versus benefit. Just like we were talking about before of our CrossFit athletes or our high level athletes, of what is the risk for doing this pull up or doing this, overhead lift or, something super heavy, or doing, running a marathon would be another example. Your body's already doing that. There's no need to run a marathon. You definitely want to be thinking about the changes that are happening in your body and the modifications that come with that. Doesn't mean that you have to stop doing everything. It just means you want to think about specifically with intra-abdominal pressure and intensity level.
So we talked about that one already.
Yes, we did.
Okay. All right, good. So athletes can continue vigorous exercise, but not without cause for concern.
Not without cause, because that's how that should read. Yes.
Okay. We've got to have a little bit of concern there.
Yes.
Okay. All right. So no more PRs in your third trimester, everybody.
No more PRs. Sorry.
Okay. That's what I hear you saying.
Yes.
All right. And myth number 3, this is the last one from this article. The only value of exercise during pregnancy is to help you lose weight more easily after your baby is born.
You can tell how I feel about that one.
You don't feel too good about that one. Explain why.
Well, one, we got to get rid of those lose the baby weight, get your body back, like that pre-baby body. Oh, we got to get rid of that language, right? Along with natural, right? We'll get rid of all of that. Certainly, the research does let us know that if you do work out during pregnancy, you have an easier recovery. And a lot of times weight loss is part of that. But I think of that more in terms of just how you feel, right? And how your body functions. But again, we talked about all the physical demands of pregnancy and labor and delivery and parenting that you want to train for. But beyond that, the mental health aspect, the emotional aspect is huge. It's just, for women, like, being able to connect with your body in that way, especially in the postpartum period, because you feel very disconnected. Your body has been through so much. Your body doesn't feel like it's your own. You often feel foreign in your body, of just like, I don't know, like I've never felt like this because it's my first time having a baby, where everything is so different. What fitness and moving your body intentionally can do for you mentally and emotionally during that time. Not to mention and I dealt with this with postpartum anxiety and postpartum depression, of it can be really healing in that way. So I could write in fact, I did in graduate school, write, an entire research paper on the benefits of, perinatal exercise, just, the whole period of what that can be beyond just the physical. So, lose the baby.
You really don't like that third one, do you?
I don't like that.
Well, I vibe with you on that, because it is that perception or the approach or the attitude, whatever word that you want to choose and use. It is about that. It's like, okay, if I understand that my approach to this is to stay strong as I possibly can, without overdoing it, so that I can have a delivery that allows me to recover in an efficient way. Like, if that's the approach, you take it much more cautiously than you would if, like, I just want to lose weight.
Yeah.
So at Burn, we've got this whole message that we preach is very similar to the message that you preach, and it's what you can gain is way more important than what you can lose.
Right.
You've had this culture of deficits and, and wanting to lose weight and needing to eat less and all these things. It's like, no, actually what we're really here for is to feel better, to gain confidence, to gain strength. I think those are the 3 things that we can replace for this language of loss.
Yeah.
I mean, we talked with a psychologist, Dr. Casey Ovides, on the last podcast that we recorded in studio. And her whole thing was about, or part of her whole thing was about language, about the subtle language that you use around whatever it is that you want in your life. Even, negative and positive language are really separated in not a fine line, in a big thick line. And, the stuff that comes into like negative language is language of loss, even subtle and different language. Like, I don't know, fine, sure, maybe, and then it's like on the other side of it, it's like this optimistic language pattern. And that's what I mean when I say approach, like, how are you approaching it? And so part of the whole approach is nutrition, right? Because what you're talking about up until this point, that's a large, it's a few pieces of the puzzle.
Sure.
It's not just one piece of the puzzle. It's a very important. But let's shift a little bit into the nutrition and into talking about how to nourish our body so that we can gain fuel rather than how to, not nourish our body so that we can lose weight better post baby.
Yeah. I mean, I think it is that whole approach of what can we add more of? We, in general nutrition terms, we're talking like, how can we add more protein? How can we add more fiber versus like, what can we take away? And I agree with you. It's diet culture that we've all grew up with of, women should be smaller, take up less space. We should shrink ourselves. We should try, even the language we have used for years in the fitness industry. Now, thankfully, that is changing. But I think when it comes to nutrition, first of all, I would say in the pregnancy period, but both, you do the best you can. So I always encourage women, give yourself grace. Don't stress about it if you're, if you feel like you're running around or you're sleep deprived and you're just snacking or doing all the things. Like, listen, you're going to be fine. Baby is going to be fine. As I said before, was super sick my entire pregnancies. There weren't very many things I could keep down. So like, I had to be okay with the fact that like, I was just eating like bagels and plain pasta. And like, as someone who was like, oh, I'm always trying to get more protein. And I, really want to make sure I'm getting these vegetables for my baby. And then all of a sudden I just couldn't. And my doctor would constantly remind me, like, the important thing is that you can eat. So, eat what you can, even if that's just the bagel, right? So giving yourself grace during that. But I think in the postpartum period, again, your body is in recovery mode. So you need to eat. This is not a time to restrict calories, especially if you're breastfeeding. But even if you're not, you're sleep deprived. We need energy. So we're not going to get that from sleep. We're going to get that from food. You need, those healthy fats and those things to, if you are breastfeeding, to increase your milk supply. And you need to be fueling your body. Again, when your body is recovering from anything, it is working really hard. So you need calories for that. You need protein, you need carbs, you need all the things. So focusing, taking a similar approach to what you would do, at any point, but taking weight loss out of the equation, knowing that if that, and listen, we always say, and we have a registered dietitian nutrition on staff with us, who's in our private community in our app. And we always say, like, if weight loss is your goal, that's okay. We want to support that. We believe that, you know your body best, but that should not be your focus, especially in the postpartum period. There's so much going on in your body and in your life. Like, if you can just focus on how can I nourish, how can I fuel? If you're hungry, eat. Your body is telling you something. Either it's because you're breastfeeding or you're tired or you just forgot to eat and you didn't realize it. Because, I never saw myself as somebody who forgot to eat. Like, I love to eat. I eat often. Mm-hmm. But when you have a newborn, like, it's hard. You're up all night. You're exhausted. So nourishing your body, hydrating certainly is really important as well. That is a time that you want to add in those electrolytes too, things like that. But really just listening to your body and being in tune to, thinking of it as fuel and nourishment and taking weight loss out of the equation.
So what are some of the strategies, specific foods, meal plans that you and your registered dietitian in the program, what are some more, like, maybe some more specific recommendations on what foods promote healthy breast milk, or what foods promote healthy recovery of any anatomy that is unnormalized? Yeah.
I mean, I think certainly when it comes to milk supply, hydration is your biggest thing. So, you're usually given that huge water bottle at the hospital, but, have one with you at all times. I had one at like the couch, the rocking chair, like all of the by the bed. Hydration, adding in some electrolytes, whether that is, just like something you mix in or just making sure that you're getting it through coconut water or things like that. And then also your healthy fats. So, I ate almost daily when I was postpartum, this granola. I would make these granola balls and it would be your peanut butter, unsweetened coconut, flaxseed, oatmeal, things like that. And it's something that I feel like 15, 20 years ago when I was starting as a trainer, I would be like, oh, that's too high calorie or that's a lot, but you need that. And you feel, oh, this is also going to help, the things that we talk about, like protein is going to keep you full. When you're going on empty, when you've been up all night with a baby and you are doing all the things, like you want that protein, you want something that is going to sustain you. So trying to, similar to the things we would talk about and just in general nutrition, but upping your hydration for sure, getting those healthy fats, high protein as best you can.
I want to know your opinion on the word diet because I have a disdain for the word
too.
diet. If you actually go into Webster's dictionary and look at what diet means, it's the habitual consumption of living organisms.
Yeah.
And then if you go and you kind of break that down and you look at habitual is defined as something essentially that's really hard to break. Like a habit means that something that you do repeatedly, almost unconsciously, and it's really hard to break. And so then, okay, I take that and then I look at the modern way that people use the word diet and it really isn't that at all. There's nothing habitual about it. Mm-mm. And it's oftentimes, we just jump on whatever the next bandwagon is. And so I'm like, how many bandwagons has there been? So I was born in 1987. I've heard about a new one ever since I can remember. Yeah. And I started going back and researching. And over the last 99 years, starting out the apple cider vinegar diet or whatever 100 years ago, you've had everything from the Mediterranean to the Atkins to the Cindy Crawford to there's this willingness by society, I think up until maybe social media got here, there's this willingness of society to just listen to journalists when it comes to what quote unquote diets they should be adhering to. And it's like, what is a journalist? No offense to journalism, but they're very important. Yeah. It's like, but like, where do you get the letters after your name to say that a glass of red wine every night is a good diet? Like, where do you get the letters after your name to say that, that cholesterol in eggs is the downfall of, is the main ingredient in heart attacks? Like, so when it comes to, nutrition, what we try to say here at Burn is don't make a change to your diet that you don't intend that you don't have the intentions of keeping forever. Like, don't just start something knowing that you're going to stop it. And so as I think through that philosophy, I'm like, okay, well, maybe potentially this could be a time where that philosophy could be modified in postpartum, but you're saying maybe not so much. You were saying maybe get a little bit more fat, but you should always get good fat and you should always stay hydrated. So if you do have a really healthy diet, a habitual consumption of food, and you feel good and your blood work is good and all that, like, do you really have to change it all that much? If you're is there an extra need for an extra hydration? If you're just like normally hydrated, we say get your 100 ounces of water a day, get your 100 grams of protein a day. If you're generally speaking doing those two things, as you and I know, you do those two things like at the minimum. Obviously we can go off the baseline and can be more contextual from there, but 100 G's of protein and 100 Z's, we call it, of water or ounces of water. So is that okay going into breastfeeding? Do you need to up it? Do you want to do more? Tell me how I'm wrong in terms of my philosophy. Like, don't add something to your diet you don't intend on keeping forever.
Well, I would say a couple things. One, that, I love that that's the philosophy here. And that's what we talk about in our nutrition program too, but most people don't get that, right? So I think that sometimes in the pre and postnatal period, that is all of a sudden we're thinking about something different. And so some people tend to get more intentional about it. So it is a good time to get into those habits. I do think you need more water, more hydration during breastfeeding, because we know that breastfeeding really dehydrates you. And again, your body is in recovery mode. So you need that in terms of like inflammation and things that are healing.
Do you have like a prescriptive amount so if I'm breastfeeding, I can take in X amount of ounces more than I normally would?
I mean, I would say, it's the like half your ounces in body weight and then some, you know, like we would say for workouts. So I think 100 is a great goal, you know. But the other thing I would say is that we also know that if you are breastfeeding, that you do need more calories. I mean, for a long time, there was that prescriptive like 500 more calories a day, or, you know, the thing that we kind of don't say anymore of like, well, you're eating for 2, because people can take that to the extreme, or, you know, that's not really what's happening.
That means 2 Whopper meals from Burger King. 2 of them. I got a baby now. I'm eating for 2.
Right. Exactly. That's where people get in trouble but it is really listening to your body. And, you know, again, like I was surprised both times when I was breastfeeding at how hungry I was and how thirsty I was. So knowing like, normally, I mean, I just ate an hour ago and I ate high protein, and normally I would feel good at this point, but I'm hungry. I'm going to take that as a cue that my body is working hard and to create this breast milk, to nourish this baby, to heal my body, and to sustain everything that I'm doing in life. So yeah. So, I mean, you know, it's hard to do because we've kind of gotten away from that. Like you need X amount more calories during this point. Cause you know, for a long time, it was like first trimester this and second and third. I think now it's much more of like listening to your body, trusting your body to tell you, okay, I am feeling thirsty. I know I need to drink more water. And like we would say in life, like pre-hydrating, like knowing, okay, I'm going to wake up really thirsty. So when I'm up at night with the baby, I'm going to make sure that I'm hydrating. When I'm, you know, like throughout the day, I'm going to be hydrating versus just when I feel thirsty. Mm-hmm, right. Mm-hmm. So yeah. So a lot of it is very similar to what we would do, but I do think you have a little bit more awareness and a little bit more intention during that time of, and especially if you're someone, and I was really lucky, I didn't have a lot of struggles with milk supply, maybe because I was eating all the time, but, a lot of people will, you know, that's a question that comes up a lot. Like, how do I increase my milk supply? I want to continue breastfeeding, or I'm seeing a dip. And if you're exercising during that time, which I hope that you are, your body is also burning through more. So knowing that you need more of that for breastfeeding, for sustaining everything else. Mm-hmm, so certainly not overeating, but not undereating. I think that's again, as women, we've been trained to eat less. And especially if you're at a time when your body feels very different than maybe what you're used to, don't go that route. Like, nourish your body, listen to your body. And yeah, if that means adding more than what you would normally do, you absolutely should. So
just so I'm clear on this, I hear you saying that the basal metabolic rate postpartum, during every phase, right, is increased, and therefore, in order for you to maintain muscle mass, you need to compensate for that. So okay, that's interesting. So if I were to ask you, we have about 2,000 trainers in Bird Nation, and we all kind of aligned on what is the baseline to make sure that, we both know most people are lost when it comes to nutrition. Like you said, the Google jungle out there, like there's 15 contradictions for every truth. Right. And so we just try to keep it very, very simple. Yeah. It's like, if the first step you can get to is 100 G's and 100 Z's, 100 ounces of water, 100 grams of protein, and you can do that. It sounds like if you are already doing that going in, then there probably isn't much need to change. You're going to already be giving your body an ample amount. Yeah. But it's usually like let's be real. Like,
most of us are not getting that.
maybe the Burn Boot Camp community might skew a little bit higher because we've been preaching it for so long. Yeah. But generally speaking, in public, like almost nobody sees 100 grams of protein in a day. Yeah. They'll come to you and be like, I've been eating protein all day long. It's like, how many grams? Yeah. Or like, tell me your sources. Right. And they're like 2 hard-boiled eggs, a protein shake, and 4 ounces. I'm like, it's like a 60. Yeah. And when you look at now newer recommendations just on protein in general, it's higher. I mean, it is like, we need to eat more. We need to, so then you think during pregnancy and postpartum, like, we need more than that, it doesn't have to be extreme, but and I think that's what you guys have done so well, is create that community where that is a lifestyle. And that's, hopefully where we all can get to be, and recognizing that there's gonna be, it's a journey. So there's gonna be times when things are different and you're gonna be super busy and you're gonna feel off your game, but that's okay. Yeah. That's part of the process. Yeah. Well, I've got something fun for us to do real quick. And then I have many more questions for you to go through. But given that we're on protein right now, Burn Boot Camp is releasing, we have this product called Afterburn. Yes. And All right, this is my plug for the day.
Oh.
Okay, so check it out. This is Afterburn, everybody, and we do seasonal flavors. All right, so we have our staple chocolate, vanilla, strawberry, both in whey and in plant. And this is a grass-fed whey version of our pina colada flavor.
Ooh,
all right, and I brought some for you.
Oh, yay.
You want to try some with me?
I would love to try it.
All right, this is out this month, Burn Nation. So pick up pina colada at your gym.
Yeah.
Or you can pick it up online. But we are going to try some right now.
Okay.
All right. Are you ready?
I'm ready. I'm excited.
Have you gotten your protein in for the day already?
I tried this morning.
How many grams of protein are you trying to get in today overall?
I mean, I do aim for that 100 at least.
Okay. Is that for real? Is that
that is what I try.
Goal? Okay,
yeah,
good.
But I will say, based on our dietitian and our staff dietitian, that, I was aiming for that 30 grams at breakfast, which is very important. And now she's recommending more, which is very hard. And it is very hard you're like, that's a lot of food. So I've been trying for that, but sometimes it's tough.
Okay.
But this looks good.
Smells
good.
I started my fitness journey post baseball. I played baseball with the San Francisco Giants organization in the minor leagues. And as a pitcher, you don't really lift for hypertrophy.
Right. Yeah.
Right. It's internal, external rotations. It's all like sports specific stuff.
Yeah.
Trying to take care of your rotator cuff.
Right.
So when I got released, I was like, I'm going to be a meathead. Yeah. Cause I couldn't bench press,
Yeah.
And so I ended up
risky.
Yeah. I ended up getting a job at Lifestyle Family Fitness down in Naples, Florida. And I learned from, he's a buddy of mine today. His name's Pete. And Pete taught me all the bodybuilder stuff.
Yeah.
These guys were doing like 350 grams of protein in a day. And like that's hard for anybody. And I'm not even sure the science around if that's too much or not, or if that's overload. But, I try to get about, and what do you think about this? I try to get about because I'm in a normal body fat range. I try to get about 2 times my, 2 times 2 grams of protein for every pound of body weight that I have.
Yeah, I think that's probably
and
right
that's
for you.
hard.
It's hard.
I rarely do it. That's like 350, 400, and I'm never there.
Yeah.
Is that too much?
That's a lot. I mean, I think, you look at what's happening in your body too. Like, you're clearly able to maintain muscle. And if you feel good in your workouts, cheers. All right, let's try it. Oh, that's pretty good.
Pretty good?
Yeah.
It's creamy, isn't it?
Yeah.
Is this water, y'all? Was this with water or almond milk? Almond milk?
I love
a little almond milk.
That is good.
Imagine this on like with like in a smoothie with like a little umbrella and a little pineapple.
I was just gonna say, we need
You
some
want a
fruit
little rum in
this.
there?
I mean, I would do it.
You need a little rum in there?
What time is it?
It's a nice poolside drink.
Yeah. No, that's really good. And I would say too, like, sometimes things feel too heavy, especially right after a workout. And that's pretty light. Like, you're getting the stuff that you need, but it's not going to sit on your stomach or feel like you're, chugging, like really having a hard time getting it in.
Yeah, we just try to like make it straightforward. Our brand, our members have a lot of trust in our brand. And so, we want, what makes us different is the things that we want to own. And so Burn Nutrition, I developed the very first Afterburn canister of protein back in, we weren't even a franchise yet. It was back in like the early days, because I knew my members would go to like GNC and just like pick some like garbage off the shelf.
That is the Wild West in that supplement world.
Yeah.
So you got to know your source.
So as a trusted brand, we're like, you know what? Yeah. Let's make sure that we provide the best products that we could possibly make. And so, this is our seasonal Afterburn flavor.
I like it.
Pina colada.
It's good.
You like it?
Yeah.
Thanks. And you guys, I told her not to blow smoke if she didn't like it. Just
I would tell you.
Spit it out all over the...
Listen, I am notorious for being a very picky eater with most things. So like, there are a lot of things I would not be able to hide it. If I didn't like it, I'd be like, oh yeah, that's good.
Yeah, that's good.
That's really good.
let me wash it away.
Yeah. No, that was good. That was really good. I liked it.
Okay, good. Certified, approved by Amy,
nice.
You guys.
Yes.
All right.
Yes.
And so, talking just finishing up the topic on nutrition and protein, the baseline at 100, but, maybe 1 gram per body pound, 2 grams per body pound if you're a bodybuilder, but 1 gram per body pound. Does that sound like something that you buy into? What is your philosophy there?
Yeah. And I would say, Vivian, our dietitian, she would say, and I would say, yes. And also do the best you can, don't overthink it. Don't stress yourself out. Like, oh my God, I'm going to lose all my muscle if I don't, if I don't get this extra protein.
Right.
Because again, maybe you're not able to because you're just, you're full. Maybe you're not able to because you're running around between school pickups and all you can eat is like leftover crust from your kid's sandwich or so, life is going to happen. So do the best you can. And again, that's what I was saying before we were drinking, like clearly you can put on muscle if you feel good on your workouts, you don't feel like, oh, I'm super fatigued or I'm not recovering well. Those are the things that you want to look at too. Because again, like we can give these recommendations. They're pretty general, but they're, we like to follow the research and see what people are saying. But at the end of the day, you have to find what works for your body. And certainly we all need more protein. We all need more fiber. We all need more water. We all need more plants. Like there's things that we can say that are kind of staples, but you have to figure out what works for you and your lifestyle. So if you don't get that 1 gram per body weight or 2, that's okay. But pay attention to how you feel. If you're feeling bad in your workouts or you feel like you can't put on muscle, or, for me, I'm entering my 40s, like I'm feeling like it's harder for me to put on muscle. So I do need to think more about my approach to nutrition because things are changing, right? So like those different times in our life where we want to be thinking, okay, what needs to change on this side? But otherwise, if you're feeling good, you're eating well, like just do the best you can.
Yeah, no, I totally buy into that approach of just like intuitively eating and how you feel. And, we'll have people, because I think education is really important. If you can just educate yourself by doing a short-term, in a predetermined short-term, like food log, we may have someone do it for 3 days, 7 days, or 30 days if they really need to educate themselves. But once you have that foundational education, we call it the eye test, and like you can eyeball chicken breast and you can get within 5 grams. You can eyeball, how much an egg white has.
Right.
And then what you can do, like if you know all the foods that are packed with protein, even if they're like high fat foods, like maybe like an almond butter or something like that, you can then, what I say, be a protein hunter. Like just make sure that no matter what you're eating, you've made the conscious connection that what's on my plate has about this many grams of protein in it. Yeah. And to me, like that takes intuitive eating and it just adds a little bit of consciousness to it.
Sure.
Because intuition is amplified by consciousness, in my opinion. And so like, okay, I need the information and I need to be educated. So maybe do a food log for 7 days. I do not want to do one like full time. I am not that type of person.
It's a lot.
It's a lot.
Yeah.
It's a lot. And so, and then to your point about generalization and general recommendations, I also, just so everybody knows, I don't really like talking about 1 pound, 1 gram per pound or 100 grams. We got to start somewhere. So that's why we picked the 100 grams. But, to somebody that's deconditioned and they're 325 pounds at 62% body fat, saying 2 grams of protein or 1 gram protein per body pound is actually really bad advice because now you're playing with like calorie surplus.
Yeah. Yeah.
So,
and that would just be a lot. That would be really hard to do also.
Just an example of like how these general recommendations don't fit everybody. But I think we're both agreeing that every human being at the baseline should be striving, not that the sky's falling if you don't get there, but you should be striving for 100 grams of protein on a 24-hour cycle. Is that fair? Yeah.
And doing the best you can. Like, I feel like it's, I had so many years, and I've heard Morgan talk about this too, of just like diet culture and like counting calories and under eating and feeling terrible in my workouts because I was under eating. I wasn't fueling properly. Like we had so many years as women, like we were conditioned in that way of being able to let all that go. Like I don't need to weigh my food. I don't need to measure. I don't need to count calories, but I do want that intentionality of, okay, but I want to fuel for this. I want to feel my best. I want to see, I want to get stronger. I want to see that muscle. I want to feel it. Having the intentionality behind looking, like you said, like being able to eyeball it versus having to count and get really into the, the numbers, which I'm not a big fan of because I think it just gets in our head, but just being the awareness, I think is key to, and how freeing to be like, I need to eat more. And also like, know that like all foods fit, I can still have the glass of wine on the weekend. I can still go out for pizza. I can still, I'm in the airport yesterday. Like I can be in the airport and eat what's available because that's what's there and it tastes good. And like, just knowing that's really freeing to not be at it. Cause we've all been in those gym spaces or those fitness spaces that are nutrition spaces that are very calculated and, number heavy. And like, that's exhausting.
Yeah. It's super exhausting.
Yeah.
I would say it's super exhausting just to be an advocate and push back a touch on that.
Yeah.
It's super exhausting for most people.
Yeah.
But what about the person that like intuitive eating is so far away? Like it's so far away. It's becoming so difficult. Do you have members or clients that they need structure. They need prescription. They need you to just, hey, can you just for a little while tell me what to do so I can get some momentum and then get there? Like teach me over time. Do you find that being a percentage of your population?
Yes. Yeah. And I think, the majority, like the reason we have jobs as trainers, like people want to be told what to do. And they want, experts to be telling them what to do and they're seeking that out. What we do is we have a plate. So Vivian, our dietitian has designed, she calls it the method, and it's a plate and you're looking at like, how can I fill half my plate with vegetables? This is what this percentage of the plate looks like if we're looking at these protein sources. So it is that visual thing that you're talking about without having to be like, oh, I gotta, count every single macro and every calorie and every single thing of, okay, what does this plate look like? And okay, look, this is why I don't feel good. I'm not getting enough protein, or this is, of course I'm not getting enough. So we do it in that visual sense of like, and, sort of looking at your starches and your starchy vegetables versus your non-starchy vegetables, things like that. So you have we call it the structure with the flexibility.
I love that.
So because also like you're not going to like everything that I like. So our plates could look totally different, but we still have the method.
Yeah. No, I love that. That's the structure that I really think. I'm glad you have the method. I think that structure helps people so much just from more people are visual than anything else. And so just to have it, to be able to be like, oh, Amy said this, Vivian said this. My plate don't look like that.
Right.
Yeah.
And sometimes it's that they're eating a lot more and sometimes they're not eating enough,
right.
So it's interesting to look at both.
Because I've also ran into people that will take intuitive eating and run with it the opposite way.
Totally.
My intuition is to smash that whole bag of Hershey Kisses right there,
Yeah.
So we do have to like play a little bit of structure game there, definitely. Because what we can't circumvent is the fact, right, that mass, not necessarily weight, because you can cut off your right arm and lose weight,
right.
But I guess you could with mass too, but mass, like it's never created nor destroyed.
Right.
And so you're only, I think really it's an equation. It's a math equation, right?
Yeah.
And at the end of the day, it's a math equation.
Yeah.
And we can't really circumvent the fact that a surplus of calories is going to add mass.
Sure.
And if you add a surplus of calories, period, you're going to store extra energy as body fat.
Yeah.
And I know that it's not about fat. It's not about what we're losing, but most people feel better. There's I would say a loose correlation. Most people feel better as they get more lean.
Yeah. And just, when you really look at the intuitive eating approach, Vivian talks about that a lot. It's, you give yourself that unconditional permission so you can heal your relationship with food.
Yeah.
Most women have a distorted, unhealthy relationship with food because, again, we grew up with that and we are training ourselves to try to be smaller.
Those damn
Less.
journalists.
I know, right? But so I think like a lot of that is about healing that part of our psyche that we, of like food is not the enemy. Food is not good nor bad. It's, and then within that, then we start to realize like, oh, my body is craving this protein or this fiber, whatever it is. But I wasn't in tune to that because I was just thinking about, I shouldn't eat this. I should eat this. I should, the things that we know don't work, know?
And how motivating is that, right? So like, I have to always not do things.
Yeah. That's awful. That's not fun.
Yeah.
So I think
stop doing that. Don't do this. Have a deficit. Lose weight.
Right.
You're too big. You're too small.
And like you said, like it's a balance, it's, I don't think anybody in the fitness and nutrition world would be like, no, you just eat whatever you want anytime. Like, and that's at the heart, that's not what intuitive eating is about. It's about the relationship. It's about what does that mean?
Right.
How can you listen to your body? And your body is going to give you those cues. We're trying to teach our kids that, right?
So you were quoted in Women's Health magazine.
Yeah. A while ago.
Congratulations on your quote.
Thanks.
It says, as women, we say things about ourselves and our bodies that we would never say to anybody else.
Mm-hmm.
I asked myself, what would I tell a friend or a client? It would be encouraging. It would be uplifting. That's how we should be speaking to ourselves and others as well. And obviously, I feel like this is very true.
Mm-hmm.
And this quote popped out at me, and I'm so critical of myself.
Mm-hmm.
Like, I mean, set gender aside. I think if you're critical on yourself, there's a what worries you masters you side to that, where worry doesn't manifest into fear, that turns into anxiety, that turns into spiraling down. But if you can have that healthy worry that kind of masters you, there's this sense of maybe people self-sabotaging, that if you are somebody who is super critical, you're constantly worried about doing the right things. Is what I'm doing right? Am I self-sabotaging?
Right.
So when you're thinking about this quote in this interview with Women's Health magazine, what would you say to women that do struggle with kind of the self-sabotage notion, and what can they do to change their mindset to become more positive?
Yeah, I mean that, and what's interesting about that quote is that was 10 years ago. So I got picked for this. It was called the Next Fitness Star with Women's Health. I was really lucky, one of 5 women, and we were in the magazine, and we were on Good Morning America, and it was a great experience. But at that time, I didn't have kids yet. I didn't have my daughter. And now it's a whole other level of like, what would I say to her, or either of my kids, my daughter or my son, but just thinking specifically my daughter, what would I say to her to motivate her? It wouldn't be the things that we say to ourselves, the, self-criticism. And I think, to your point of worry, like we often think, okay, if it's the idea of like thinking of exercise as punishment or food restriction as punishment versus like, I get to do this. I get to do this because it feels good, because it makes me strong and healthy. Like, why would we think I would not tell my daughter, you should do this because of, this negative consequence. I would focus on the positive. Like, she's going out to play soccer and she loves it. And it's, it's about like, go play with your team and have a good time. And we practice because we want to get better. It wouldn't be like, because you're going to lose or you're going to be out of shape, or, how would we talk to our children and our best friends to motivate them? It would be a different approach. And I think as coaches, we have that, right? Mm-hmm. Like it's not, I have long believed that negative reinforcement in a camp it doesn't work, right? But what we do know is that when people feel successful, whatever that is for them, maybe that's doing 1 push-up, maybe it's doing 20 push-ups. If they feel successful, they want to come back, So I think we look at motivating people. Why would we not speak to ourselves in the same way? And it is hard. We are obviously always our own worst critic. It is hard to maintain that. And I think that's, I always said, especially in my postpartum workouts, I would say, I'm saying these things to you, to my online audience. I'm saying these to you because this is what I need to hear too. I need to hear that one of the things I always say is just show up. Like, I'm successful if I showed up today. And sometimes that's all we need to hear. It's just about, walking through the door or putting on the shoes or whatever it is for you, like motivating yourself because you think of, again, what you can gain, how am I going to feel? What is this doing for me versus like, what do I need to lose? What negative, awful, terrible thing is going to happen if I don't do this? Like, that's not motivating, especially in the long term. So
yeah, for sure.
Yeah.
And I've noticed people that maybe have that tendency to live in that negative emotional state. It's a byproduct of mostly their environment and how they've grown up, but they will then, when you're in that negative state, we'll tend to find things that reinforce the state that you're in. So if I'm, I've got to lose all this weight and I'm just out of shape and, I just don't have any energy. When it's like, well, how can I go work out if I don't have any energy?
Right.
How can I go? And, it just cascades. And so I mentioned Dr. Casey again. We talked about the set of your mind. Like, what is a mindset? It's a set of the beliefs that you have, and the way that you solidify a belief is having a thought, then having an experience, and then turning that thought and experience into a positive experience. And then that positivity is really what generates the momentum over and over and over and over. And so if we're constantly in this negative state of mind, especially, and we're just talking, you don't have to be universally negative, but if it comes to your fitness and your health and you'll start to find excuses like, my parents were big boned and I didn't have the resources growing up and I'm not internally motivated. You start telling yourself all the things that you are. Well, then of course you're going to be what you believe you are. Right. So talk to me just a little bit about that. I've got one more real question that I want to go deep in on, but I feel like you've got more on mindset and how we talk to ourselves and how we can connect with ourselves before we have this expectation to have positive relationships with other people in our lives, in our family, in our house, in our workplace, in our community. And, there's some people I know that want to take over the world before they've mastered cleaning out their car.
Yeah. Right.
You know what I mean?
Yeah. I mean, I feel like it is, it's so much how we talk about things. And if you say it enough, you will believe it. And that can go both ways. So maybe you don't believe, oh, I'm strong and I'm capable, but if I just say that to myself, eventually you will believe that. And I think it's, something I always say often at the end of a workout is I say, it's hard because you're working hard. How often do we feel winded or our muscles are screaming at us or we're about to collapse after a workout and our brains go to oh, you're so out of shape. Oh, you're not, versus, oh, I feel this way because that was really hard. I just did this really hard thing. So I like to remind people that's hard because you're working hard, because you showed up to challenge yourself. It's not hard because you're out of shape. It's not hard because you can't do it. It's hard because you did do it, right? So it's so much about how we talk to ourselves. And that's something, there's a trend in YouTube workouts right now with, a lot of the market became really saturated during the pandemic, which is fine. Every trainer, is putting their stuff online, which is great. I think that helped a lot of people. But there's a trend of just blasting the music, putting a timer, and just putting workouts out there. And they're fine workouts. And I'm sure these people are great trainers, but there's no coaching, there's no motivation, there's no cueing. That kind of stuff drives me crazy. But I think because people do need to hear those reminders. And I think, certainly Burn seems to do that really well, of just and the high fives of that positive reinforcement, what that does for our brains getting us to want to come back, versus you might feel totally exhausted and you're sore for days, but your memory of that is the high five at the end and how good you felt, versus oh, that was really hard, or I felt embarrassed that I couldn't do, the highest step, or that I couldn't lift as heavy as this person next to me. You're not going to remember that. You're going to remember the high fives. You're going to remember how you felt. And so that mindset to me is everything. I think it really comes into play when talking about prenatal and postnatal fitness, you're in a very emotional state for a lot is going on in your body, a lot is going on in your life, reminding yourself that you're showing up for yourself, you're showing up for your family, you're showing up to get strong. And if things feel challenging, that's because you challenged yourself. It's not because you can't do it, it's because you can. So I feel like that's such an important thing that you guys seem to do really well.
Yeah, when we were in DC doing a workout, I saw that you were in Atlanta at Battery Park at the Atlanta Braves Stadium doing a workout, which was super cool. And I was like, because I knew you were obviously coming in to have a chat with me, and I knew who you were already, but I was stalking you a little bit extra during that time because I wanted to be prepared and have a good conversation. And so I really enjoyed your energy and your positivity. Just outside, everybody looked like they're having such a great time. Yeah, and that's what it's all about. We need more of that. We need more.
And then people want to come back.
Yeah, they want to come back, and it doesn't. We always say relatively challenging, it's, the classic RPE.
Right.
For
challenging
those of you,
for you.
Yeah. The rate of perceived exertion is something we talk, that scale that we all learn in our exercise science programs, or it's just back to the talk test, right? That we talked about earlier. That's part of that scale.
1 to 10.
I think talk test is at like maybe like 8 or something. Like once you get over 8, then And when you get people to that, they're not in prenatal environment. Once you get them over that 8, that 9, that 10, that's when you're talking about that hard work really works. I saw that in your video, in a lot of your videos. Like people were working their butts off out there. And same thing with us in DC. And I was like, you know what? We're cut from the same cloth. Like we really have this optimistic, positive approach, but not one that is adolescent or naive. There are still a lot of struggles and tragedies that we deal with, which is why mental health is so important, and just understanding the mindset and just base plate psychology for people. Right. As you move forward and as you do more events like this, you're a businesswoman, you were one of the top 5 up and coming female trainers in America, according to Women's Health magazine. Like you've really made a name for yourself in the industry. And as you think about combining physical, mental, emotional, spiritual health, what does Body Fit by Amy look like moving forward? And what is the real big, audacious mission that you have? And maybe talk to a little bit about maybe an example of somebody that you've worked with that has really been a case study for that.
Well, I think, I would say to your point, it's building community. I think that's what you guys do so well. I think that's what we do really well. Ours is just more in the online space, right? And I think you can find it where you want. I was telling you this earlier. I was talking to my sister who had a really challenging time in her life. She had to relocate to Alabama and for some stuff going on with her family. And she was like, oh, Burn Boot Camp, I know them. They totally saved me. She had this great story about a really tough time. She's in a new city. She doesn't know anybody. She seeks out a gym knowing, she has a sister who's a trainer who could send her workouts. I could send her videos. I could program for her, but she needed that community at that time. And she had all good things to say about Burn and how important it was for her and how she loved the approach. And she said she was fangirling that I got to meet you guys. But I think that's so important. I think that is the feedback that we get, especially from the mom community, is that, you may not be at a time in your life where you can get out of the house and go to a gym or get together. So you want to find that community elsewhere, and you want to find something that makes you feel good for showing up, that you're going to get the instruction and the education and the information that you need. You're going to get a good workout, but you're going to be able to tailor it to you. So I think for us, we've tried to just continue to build the community. I had a lot of years in gyms, working the gym hours, the 5 a.m. to 10 p.m., which I'm sure you did too. Just like, that's not really sustainable in the long run. It's very hard to grow in that way because there's only so many hours in the day. And when we started the YouTube channel, it was all my husband's idea. He comes from a background of television production. The idea was that we could just put workouts out there for other people who maybe they weren't as accessible. We wanted to make fitness accessible. And at first I thought like, okay, our family and friends are going to watch this. And then it started to grow. And now we have a big international community. So in addition to the US, so it's just like watching that and having these women write to me and say like this, this saved me during the pandemic, or this saved me during my pregnancy because this was the only way I could exercise, or this is the only way I could connect with people. So we've tried to grow on that. We launched our app, which is our private community, our Body Fit Athletic Club. So that's where we can get to know people. That's where people get, more access to me and to Vivian, our dietitian, but that's where we also get to hear more people's stories. And then just recently, like you saw in Atlanta, we've been doing some in-person events. We'd love to do one in Charlotte sometime. So we'll have to.
We got to team up and do an event together.
I was going to say that would be really fun.
Yeah.
Because our online community has asked for that, and they're all over. Just realizing like these are people that we've connected with for years, maybe. And, a lot of people are like, my kids are the same age as yours. I went through pregnancies at the same time as you. So finding more ways to connect, because I think at the end of the day, that's what people are striving for. They want to be in shape, they want to be healthy, they want to be strong, but they want community. And clearly you guys do that really well. And I think we're trying to continue to do that in the online space of providing that for people.
Well, it's exciting that you're doing more physical stuff as well. Because I think there's going to be an increasing demand on that
we're seeing that in
the industry.
For sure. Yeah. We're seeing sort of the opposite of what happened in 2020. People are going back. People are craving that. People are wanting behind that. So
there's going to be this demand to have both.
Yeah.
Right. To be really, truly,
and to
truly
like what you
omnichannel.
guys, where you have options. Like you could be traveling and you can be virtual, or you can be, at home and walk into your camp.
Yeah, there you go. You're doing great with that, by the way. And your international community happens to be traveling to the States or whatever, and you're doing
we did in fact have some people travel, which was awesome.
Yeah, no, you're super inspiring.
Thanks.
And so I guess you've answered a lot of questions that I was intuitively curious about. I think the last one that we haven't really touched on is life as a mom, as a businesswoman, as a wife, as somebody who is mission oriented, entrepreneurial, out trying to build this amazing community and add value to the world. You got to still take care of yourself, right?
Yeah.
So what's the challenges in your lifestyle? How does your husband, your children, how do they support you in this journey?
Yeah. Well, I will say, we have very similar stories in the fact that my husband and I work together. You and Morgan work together. We created our company together. And I mean, that has so many privileges. Like we feel like we have flexibility. We can do school drop off. We can do the soccer games. It might mean that you're always on, you're always working. It probably means that you're working late nights when the kids are in bed and things like that. But we've been really lucky to have that. As I said, my husband was full-time in TV production. And then really during the pandemic, we kind of shifted, but he was looking to have, a better schedule, a better, TV production is not that this is that much different. It's just at home. But wanting to be with our kids more, wanting to have more flexibility. And then also like we were growing so much that we needed, to all be full-time. So we shifted to that. And I think within that, we just, because we're together so much, and you could relate to that. Like my joke is always that I feel like Kurt must get sick of hearing my voice because he edits all the fitness videos too. So I'm like, you listen to me at home, you listen to me at work, you're editing my fitness videos. Like, are you tired of hearing me talk?
Do you train him?
No,
Okay.
he will not. Listen, he does his own thing and he's very strong, but
Morgan hates when I train her too.
We very quickly realized in our dating relationship that part was not.
We got to keep that separate.
Yes, totally.
Because I'm like, you can pick those 35 pounds up, and she's like, not today.
Yeah, I know. I can.
I just got here.
Yes.
Okay, I'm here.
Yeah.
Leave me alone.
Exactly. Yeah, it's fun. We feel very lucky to do it, but it's not without its challenges. We certainly have a lot of jokes about that and know when we have our, we need our space and things like that. So I think that, we're pretty intuitive on what each other needs. We just try to be like, I think he's kind of famous for saying like, yeah, you should go work out. Basically like you're in a mood. You should. I know you're gonna feel better.
Nudge, nudge.
Like very gently. So certainly fitness. I mean, I'm lucky because it is my job. So we're on a filming schedule that I have to work out, but I also have to set aside time for workouts where I'm not on camera. I mean, that is a different energy that you bring to being on camera versus even leading an in-person camp or doing your own workout. Like it requires a different level of energy and it's challenging. So I have to set aside some time to do my own workouts. Every Mother's Day, my only wish is just I go for a hike by myself, completely by myself. I don't listen to I just hike. So things like that of just knowing like I need the silence, I need, but it can be really hard. Like when you have your own business, there's always work to do. It never stops. You never feel caught up. You never feel like, oh, okay, I accomplished that because there's always a long to-do list of just setting the boundaries with that, especially in the online space. You're always going to get the emails. You're always going to get the messages. You're always going to have the community be needing something. And since mine are all over the world, then it's like somebody at 3 a.m. has, I'm not checking, but so learning to set your boundaries, I think with that of like, yes, I'm all in for this business, but I have to set boundaries. And right now I'm with my kids, like trying to just be all in when it's family time, all in when it's work time. It's gotten easier as both my kids are in school. My little one started kindergarten. So it's a little easier to manage that now, but it still is, it's all never ending. So we just have to be really, really intentional about it.
Yeah.
So,
yeah. Well, I appreciate you coming here today and really just laying it all out there, teaching us pre and postnatal. I thought that was so fascinating to hear your story and I'm very intuitive. You just have such a pure heart.
Thank you.
Yeah. And I feel like we're going to be friends after this.
I think we will be.
I think so.
Yes.
I think so too.
I also think you and I are very similar. I was listening to you in an interview as I was stalking and preparing. And you said that you and Morgan have just like sort of shifted your titles and that she's the CEO because she's very organized and getting things done. And you're the visionary because you need your creative space. So I told my husband that last night. I was like, we are stealing that because that's what it is. I'm the visionary. I'm like doing like and he is the, he's a TV producer. He is the schedule, the budget, the like all of the like little things that I'm just like, what time is it?
Right.
I'm like, I think we're the opposite. You and I are he and Morgan probably would get along really well.
We're the visionaries.
Yeah.
The thing that I had to agree to ahead of making that decision, and just as a prerequisite, if you do make this decision, the integrator always gets the tiebreaker.
Oh, okay.
If there's a 1 and a 2 and you're at odds, whatever that integrator says goes.
Okay, good to know.
And they gave you the power to have the ideas. You got to give them the power to then say yes and no to ideas, because we probably both have a notebook full of like pictures and doodles and ideas. And
we do, and then they tell us why it won't work. And we're like, oh, man.
I thought that was genius. Well, this has been so much fun. And before we wrap up the interview, I just wanted to give you one last time to maybe look into the eyes of Burn Nation and to really inspire and motivate our group here as they're listening to the podcast, spending their hard-earned time here. I would not want them to go away without hearing, that last bit of inspiration from you.
Oh gosh, no, I got to think of something really good. No, I mean, I think it's, that you clearly have an amazing community here at Burn, and that's what it's about. And I think, it's showing up for yourself, showing up for camp, showing up to do your workouts, showing up for your community, showing up for the people around you, and just keep moving. It's at the end of the day, again, it's consistency, it's moving, it's finding ways that bring you joy and that don't feel like punishment, that feel like a reward, that you get to move your body and show up with your friends and work out every day. So I think you guys already do that. So
Amy Kiser Schemper, thank you so much for being here. Yes.
This is great.
Bodyfitbyamy.com, youtube.com/ at bodyfitmoms or bodyfit by Amy.
Yeah, there's 2 different channels, but you can find the prenatal postnatal on the Bodyfit by Amy channel as well.
Okay, that sounds really good, and I'm just excited to continue to follow you. We've got to do something together.
We do, yes.
We've got to do something together. I think that would be really cool. We'll plan
really
on that.
Fun.
And I know Burn Nation has enjoyed hearing from you so much today.
Thank you so much.
Thanks for being here.
Thanks.
We're gonna end it like we always do, people.
Ready?
2 claps on 2. 1, 2. All right.
I did it.
Take care. We'll see you guys next time.
Thank you.